Members, welcome to this afternoon's Health and Community Committee. You are hereby summoned to attend the meeting. There's a little echo here. We'll just maybe hold a second. You're hereby summoned to attend the meeting of the Health and Community Committee, which will be a hybrid socially distanced meeting to be conducted remotely via WebEx and also physically in the Council Chamber, Guildhall, Derry, on Thursday, the 11th of November at 4 p.m. So starting with the roll call, Alderman Devaney.
Here, Karen.
Alderman Guy.
Here, Karen.
Alderman Kerrigan.
Here, Karen.
Councillor Sonoya Barr.
Here, Karen.
Councillor Boyd.
Shaw, Karen.
Councillor Carr. Councillor Duffy.
Shaw.
Councillor Edwards.
Shaw, Karen.
Councillor Farrell.
Here.
Councillor Ferguson.
Here, Karen.
Councillor Fleming.
Shaw.
Councillor Harkin. Councillor McGinley.
And Shaw, Karen.
Councillor Cheney.
Here.
And can I just double check Councillor Carr? Okay, thank you, members.
Folks, if you could bear with us, just to see if we get that. Testing. Okay, thank you. Thank you, Karen. Folks, if I could read out the statement in terms of broadcast statement. I would like to remind everyone present at this meeting in the Guildhall or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you're consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council privacy notice may be found on the Council website, www.derrystrabane.com. Item 4, members' declaration of members' interests can either be stated now or as the meeting goes on. And moving on, members, to item 5, and on your behalf, can I welcome an important delegation from the Western Health and Social Care Trust to present on their winter plan in terms of delivery and resilience plan. And on your behalf, if I could welcome Teresa Malloy, Director of Performance and Service Improvement, Bob Brown, Director of Primary Care and Older People's Services, Executive Director of Nursing, and Oliver Kelly, Head of Communications from the Western Health and Social Care Trust. We've had apologies from Geraldine McKay, Director of Acute Services, and Geraldine has been called away to a regional meeting of importance. So if I could welcome you, Teresa, Bob, and Oliver, and hand over to yourselves, and then we'll come back to members if that's okay. Thank you.
Very much, Chair. just checking if everybody can hear me.
We
Thank
can
you.
hear you. It's a wee bit low. If I know.
Keep the mic quite close then. Thank you, Chair. Chair, there's a few slides that were available. I don't know whether or not the Secretariat's going to load those up for us. We can work ahead without them if that's necessary. Thank you very much.
Were you asking something there? Because I didn't actually catch that. Sorry.
No, it's okay, Chair. It was just to load up the slides. I wasn't sure if you'd received those
Okay.
beforehand. Thank you very much. So, Chair, thank you very much to council members for the invitation today to the committee. Again, could I add apologies from Geraldine Mackay, has had to attend at short notice a critical care meeting this afternoon. And Bob Brown, our Operational Director of Older Persons Services and our Executive Director of Nursing, will step in to cover Geraldine's normal input to the meeting. But it may well mean, Chair, that issues of detail which your members ask about, we may need to take away today. And Oliver will keep a very good record of inquiries and any things that we have to follow up on from today, Chair. And we'll make sure that we get the information for you that you need and ask for. This is a specific briefing to council members today on our service delivery plan covering the winter period. And just as an introductory remark before we move on to the detail of that, it would be normal, Chair, that the Trust would come to Council to brief the Council on our annual plan for the Trust. But as members will know, along with other ways of doing our business, the Department did suspend the normal planning and business planning processes in trusts as we entered the first wave of the pandemic last year. So since June of last year, June 20, and just after the first wave of COVID, trusts have been asked by the Department to operate a 3-monthly planning cycle, which reflects, I suppose, the uncertain environment that we're all working in, and also started to focus us on rebuild of services at that time. And since then, quite properly, we've seen that uncertainty manifest itself as we've come through further waves of COVID. And during that period, since June 20, we have continued with the approach to 3-monthly plans, some of which are published on our website. And certainly we within the Trust, along with the board and department, are focused on a cycle that is on a 3-monthly basis. So in the West, our second wave of COVID began in late September last year, and we had 2 peaks of COVID in our hospitals, particularly in that wave, one in October and one in January in the northern sector, one sustained wave in the southern sector. And then the third wave began at the end of August or early September. And our peaks of COVID bed usage in our hospital services have varied. We had across the Trust in our hospitals 52 people at the peak in wave 1. And we went up to 129 people in our hospitals who were COVID positive in wave 2, and that was in January of this year. So you can see how difficult it has been to manage and run services during those periods. So during the wave 2 and wave 3, we have not stood down services in the way that we did in wave 1. We have continued to attempt to rebuild our capacity, but that's been tremendously difficult given the uncertainty and the continuation of COVID across our communities and its effect on our services. So we have at times experienced service disruptions, or we've had to scale back services, particularly at times when we've had COVID outbreaks or sickness absence, which affect our services and our service teams. At times when we've had to support surge for ICU regionally, particularly, or where crisis or emergency demand has required us to postpone or scale back planned or elective services. So in this plan, which is from October 21 onwards, The Department of Health and Health and Social Care Board have asked us to prepare a single plan that recognises the normal steps that we take for winter resilience and which combines these with the importance of protecting capacity and managing COVID demand, as well as maintaining regional priorities, including unscheduled and elective work. So as you can imagine, that's an enormously difficult task and a big ask of trusts. And we would ask for public support and council support to help minimise the transmission of COVID in line with public health guidance, and also ask that the population strives to be vaccinated and receive their booster if that's appropriate going into this winter period. Chair, the plan is a published plan. As you can see, it covers all of the areas that are on the slide. It also sets out the planning principles, including system-wide working, particularly I've referred to ICU, and that has been happening really since the start of the pandemic. It also refers to the balance between elective care and the pressures of COVID, and it talks about the challenges in delivering the plan. And you'll see, if you have an opportunity to read it in detail, that our challenges tend to be dominated by the challenge to safely staff all of our services, particularly in view of ongoing absence and vacancies, and also the importance of supporting our staff and looking after their well-being given the long period of the pandemic. Chair, we have a couple of slides now which Bob Brown will take you through, which really refers in a little more detail to our hospital and our community services. Thank you very much, Chair. Bob, I'll hand over to you.
Thank you.
Good afternoon, Chair, and to all the members of the Council. Thank you for the invite today. Please say at any point if you're not hearing me clearly. I trust you will, and grateful for your support. As Teresa mentioned, local council members can help us in a number of ways, as you've done before, and hopefully will continue to do. I'll just take Geraldine's first slide there. There's two slides really for me. The first one's on our hospital services, and then I'll follow up in my own areas in the community with the second slide. And Geraldine would want the members to know that in the last week there's been a very slight, but 4% reduction in the numbers of people who have COVID in the Strabane and Derry area who are being tested positive. That's last 7 days in comparison with the previous 7. Fermanagh is up, however, by 22% for Fermanagh and Omagh area. There are parts right across Northern Ireland that is fluctuating so quickly. Northern Ireland has had a 9% increase in the 7 days in comparison with the previous 7. So it's so changeable, as I think you're familiar with. In our hospitals, we have today 64 people who are admitted with COVID. And again, that situation fluctuates, but it has been relatively stable in the last couple of months. In August, we were in the peak of that fourth surge that Teresa referred to, and we're seeing in and around about 50 to 60% of patients admitted to hospital who have had a double vaccine. So we've always known that whilst the vaccine is absolutely crucial to continue to promote indeed the booster, it doesn't necessarily prevent COVID, and there are risks that we need to continue to monitor and be assured around in terms of practice. I just want to then go on and say a little bit about critical care. It is one of our key risk areas, intensive care beds in both Altnagelvin and in Southwest Acute. We are anticipating that COVID will continue to present significant challenges for at least the next year, and throughout all of that time, there will likely be peaks and troughs in terms of the numbers, and sadly, there are a significant number who continue to require intensive care. But as Teresa also said, we're also running more than in the previous surges our normal services. So people who may have other surgery that require an intensive care bed are deserving of that service equally so. But we have, as you'll have read within our resilience plan, we can go up to a maximum of 16 beds in Altnagelvin and 6 in the Southwest Acute Hospital. We're at 13, 12, 13 in Altnagelvin, and we're at 6 in Southwest Acute, and the region is very close to capacity, and that's why Geraldine's taken part in a regional meeting regarding intensive care bed availability. And the workforce, the ability to staff these beds is the #1 risk. So I'll just move on perhaps to unscheduled care. And when I refer to unscheduled care, that those are attendances in our emergency department in a non-planned nature, and those are people who could have a whole range of situations, which can include mental health crisis, for example, but mostly physical ill health, and it should be an urgent and an emergency situation. And there's been a lot of work done on the across the region, but as you know from the media, and as I will also say to you, the pressure remains extremely high in our emergency department and across really all hospital services. We have a bed occupancy of 93%, and you'll have seen in the winter plan, it's modelled across the potential for the occupancy to go 5, 10 to 20% higher, and what that means. So 93% occupancy today in Altnagelvin, and 98% occupancy in Southwest Acute Hospital. So it's a very challenging situation overall, and it's one that as we move into December, and we all know how that Christmas and particularly the first 2 weeks of January are usually the most difficult weeks of all for services. It will be a huge test for the system. And on the last bullet point of Geraldine's slide, the elective surgery activity, again, as Teresa has indicated, we're doing our very best to reset all surgery, and whether that's a day case or an inpatient stay, we're doing that quite well, and the winter plan intends to continue to build that higher. Always our focus on urgent cases, on cancer cases, on emergency red flag type surgery. And we monitor our delivery of that, of course, every day through to the region. And whenever we have cancellations, it's either bed availability or workforce availability. And that's a challenge the whole system, indeed the whole country, is facing at present. So I think I can move across to the next slide, please, which is the community slide. And just as we move across to that next slide, I'll say that within the winter plan, one of the most crucial elements is how can community services help the hospitals. And the department and the board have been asking us to submit proposals for additional bed capacity in community settings, ways of also facilitating discharge for people who might be waiting a domiciliary care package or a care home bed, and I'll say a little bit more about that, but I would want the council members to know that we're actively pursuing the ability to put in additional bed capacity in the community. Again, the workforce is our #1 challenge, workforce availability, whether that's COVID-related sickness or other related sickness, as well as turnover in some areas. The number of leavers is quite significant for other reasons too that perhaps we'll come to. But we're responding to that request to further build, where possible, capacity in the community. I'll just perhaps summarize first of all in terms of COVID outbreaks in the community. In care homes and in supported living and in other situations, we currently have 8 outbreaks, COVID outbreaks, and in mid-August, that was 27. So that's coming down in the right direction. Today there are 42 outbreaks across the region, so we've 8 out of 42 in our trust area. Mid-August there's 122 outbreaks in mostly care homes at that surge point. And our outbreaks are taking place in a range of settings, and the definition of an outbreak really just requires more than one person to have a COVID positive test, staff member or resident. And so it's a situation which fluctuates very, very quickly. We have a tremendously proactive care home support team. They're a small team. They were established at the beginning of COVID, and they continue to provide tremendous day-to-day support to the care home sector, whether that's advice, guidance on anything from PPE through to staffing, and direct support with GPs, care home team, and so forth. And we're aiming to further build that program. We meet with the care homes every alternate Tuesday, and we talk through their ability to maintain flow into care homes and so forth. And then moving to domiciliary care, and council members will be very familiar with quite a lot of media coverage in recent days, and we are actively pursuing a communication plan with at a number of levels that I'll perhaps refer to shortly. But it would be important for the council members to understand that the main challenges in domiciliary care, the majority of our independent providers are having significant challenge with staff absence and indeed turnover, leavers, and an inability to replace those leavers as quickly as they might like. And there have been a number of questions asked across the region in recent days regarding the ability to provide gaps in care, depending on a person's assessed need. We are actually doing best in comparison with all trusts in terms of the overall number of people who have a gap in their care. They're not able to get out of hospital because of unavailability of a carer, for example. 141 is our position of the number of clients who are either delayed or don't have their full package of care. The highest number in the region is 424. So our 141 amounts to 1,200 hours. The total in the region of missed hours is 15,000 in recent days. So there's a lot of work. The terms and conditions is a key issue, and the department have been working with the trusts to identify ways this winter to incentivize domiciliary care. There's been some calculations which have indicated that assuming that an increase in the hourly rate gets straight into the carer's hands rather than to the provider's hands, it could have a very significant impact on recruitment, even a £2 per hour increase. So that's with the department. We've made our case, and we're working on that proactively. Another very key matter has been the £500 payment through COVID, recognition payment, and that's not in every case in the hands of carers, and that's something that we've further escalated, and we're assured that the process is now happening proactively. Apart from that, then it's about continuous recruitment, other ways of supporting carers that we're getting on with. And I would also just want to say, you'll have noted perhaps in the media some reference made to our deliver and value work, which is really around rota optimization. There's 2 years of work already done on this, which we paused during the initial COVID surges, but there's been some highlighted references, particularly in the Limma Valley area, and that's something that we're managing, and we're proactively seeking to work with families, with clients where appropriate, with the social work staff, with the care agencies, and indeed right through to our own trust board, and including yourselves today, in terms of our communication on that work. And also on domiciliary care, I should just say, because it will be of interest to the council, we are retendering our service. We're required to retender our services across the whole trust area. We procured in 2017 for our independent domiciliary care contracts. So that was a 3-year time frame with 2 12-month extensions. So that time's now up, and we're actually legally required through public contract regulation to do that. And it's a process that's proactively underway. And that's something that we will continue to communicate appropriately with all relevant agencies, particularly at care and staff level. And finally, on this point, there have been in recent days and always are some families who are either very concerned because they can't get a family member out of hospital, or they don't have, they believe, sufficient care hours met. We always have had both a city side and a rural location challenge in terms of workforce, and that right across the region. And I would want the council to feel assured that we will continue to work every day to liaise appropriately with relevant people, as well as MLAs and so forth, to address individual situations. So as I move just to a conclusion, the GP COVID Centre in the Altnagalvin site continues to be available, but GPs are mostly managing COVID in their own GP practices, with a few exceptions. But we keep that pathway available if necessary. I should have said that our day centres are largely in place. There are a few COVID regulatory requirements that have meant that older people's and learning disability and other day centres have not got to the maximum that they were pre-COVID, such as social distancing and so forth. But we know how important they are, and we're proactively building the numbers as we would have wanted to do. And then on visiting, it's such a hot topic. There's not a day go by that hospital visiting isn't referenced in one area or another. Hopefully the council members will know, and we can share it with you at any point in time, the regional visiting guidance. At present in our hospitals, it's 1 visitor from a pool of 2 family members. So 1 visitor at a time, maximum 1 hour, and once per day in all of our hospitals. Now, there are some exceptions. In a COVID ward, we have to assess risk very carefully, and also in intensive care. And we also facilitate appropriate visiting in our maternity and paediatric services, and also we would increase visiting as appropriately as possible in an end of life situation, or for example, if a person would benefit from should they have, for example, a disability, being with a loved one more frequently. And in the care homes, and the guidance is up to 3 visits per week, and that's working quite well. And we're absolutely delighted. This will be my final point, that the Western Trust area has led the way across the region for vaccines in care homes. We've just had the booster program, which has delivered for a high majority of residents in care homes. We were delighted that we had over 90% for the first 2 jabs for residents, and for staff it was in the mid-80s. And we have some work to do to encourage staff to have their booster. That's been a more disappointing percentage in recent weeks. Right across the system, it seems that there's more of a reluctance to have the 3rd jab, for perhaps a number of reasons. But we would want to continue clearly to promote that. We know it saves lives, and we're grateful for your continued support to do so. So thank you to the chair and to the members.
On behalf of committee, thanks to yourselves for the presentations, and I'm going to open it up to the floor and maybe take a number of councillors at a time and then come back to yourselves and try and work through obviously some of the very key issues that yourselves have covered and which councillors may want to raise. If I could also just note, and it's in the chat box, that Councillor Maeve O'Neill has declared an interest on the basis of being an employee for Western Health and Social Care Trust. Thank you, Maeve. So in terms of, I have 3 speakers, folks. So if I could start off with Councillor Tierney. Brian.
Thank you, Chair, and thanks to Bob and Teresa for their presentations. I suppose at the outset, as a member of the LCG of the Western Trust, I would like to declare an interest as well. I suppose first of all, I want to thank on behalf of the SDLP you and your staff right across the health service for the tremendous effort that you have put in right throughout this pandemic from the very start, trying to make sure that we were doing all we could to keep people safe and trying to make sure that the public were getting the appropriate messages at the appropriate time. I think has gone a long, long way and has saved many, many lives across this council district. So thank you very much for that. I have no issue whatsoever in working with yourselves to encourage as many people across this council area to take up the vaccine and the booster. I got the booster myself today at Templemore Sports Complex. It was a very straightforward process. I was there for just over 20 minutes and I'm quite happy and content that was offered to me. So thank you for that as well. In terms of the staff who are dealing directly with patients who are dealing with COVID-19, obviously this pandemic has been going on since January 2020 or somewhere around that. Is it the same staff who are working in the COVID wards from then to now? And if so, what support is available to those members of staff? Because dealing with COVID-19 from then to now has to have an impact on individuals and trying to do all that they can to make sure that they don't become infected either in the hospital or out about in their own business, to make sure that they're ready and available to help protect patients and make sure that the appropriate care has been given. So I would like to know, in terms of the staff who are there, is there a rotational basis if you're on a COVID ward and on a non-COVID ward, or what way does that work? And if you are in the, if you like, in the thick of it, what support is being offered to staff in relation to that? Because it can't be a nice place to be. I'm sure you'll agree. In relation to some of the issues that are brought to me as a local representative, we often hear about people, and Bob mentioned it in his presentation, people who are presenting at A&E in mental health crisis. We often hear that they're left sitting in waiting rooms and maybe left to see if they sober up or whatever it may be. But it's not a nice place to be sitting in a waiting room when you're in that type of condition, either for that particular patient or for other patients who are there waiting on any other kind of treatment. So is there any steps in place, or what steps are in place to ensure that people with mental health crises or mental health conditions who present at A&E aren't sitting in full view of the public and in the waiting area? I think that would be something that we could look at as well. And I am aware that there is a youth service provision now within A&E, which I think is really a really good step to try and make sure that young people who are attending are looked after and guided through that process. Bob also talked about building capacity in community services. Neighbourhood nursing teams were set up, as I understand, as a recommendation from the Bangor report, and I understand that there are only a few of them within the Western Trust area. I think that there are one here in Derry and possibly another in Limavady. Why would that be the case, that we only have a few within the Western Trust area. If a focus for the Trust, as we are being told now, is about building capacity within community services, and this is as I understand, a direct recommendation from the Bangor report, and speaking to some of the staff who work in these teams, they seem to be working well, and they're changing how community nurses and community services are delivered. Then, if they are working well, what steps are in place to ensure that we have more of those teams working across the Trust area? The one that also always gets me is a staffing issue, and I never quite can understand it. I'm sure you're well aware of the numbers. You probably obviously would know better than us on the numbers of staff here, and with the Western Trust banking and working through banking agencies. A lot of these, I've heard of a number of staff who have left the Western Trust and decided to take on banking. They're on the same ward, doing the same job, on the same shifts for more money. And to me, that just doesn't make sense. How can the Western Trust pay a direct member of staff a particular wage and then pay a banking agency money that the banking agency has to take out their cut, and also a higher hourly rate than what the Trust can pay? Surely that doesn't make financial sense. Would it not be better at looking at how we can build that capacity and ensuring that people are getting and are feeling valued and getting the right terms and conditions within their contract? And surely then working as direct employees of the Trust would be better for everyone concerned. But that's all the questions that I have at this stage here. And once again, I want to thank the Bob and Teresa and all of the staff across the Western Trust for the efforts that they have put on to date, and have no doubt will put on over the coming weeks and months, and guiding us through this winter, which everyone is saying is going to be very, very difficult for our healthcare staff. And please be assured that you have our full support in doing that. Thank you.
Thank you, Brian. And just to say to yourselves, Teresa and Bob, just in terms of to try and work our way through this, I've had 7 other speakers, so I'm going to take another 2 and sort of do it in groups of 3 and come back to yourselves after the third. So, Mr. Farrell, Rory, please.
Thanks, Chair, and thanks, Bob and Teresa, and thanks to your teams right across the Trust who care for us as a society on a daily basis to keep us healthy, to keep us alive. So on behalf of the SDLP, thanks for that. I want to touch on 2 issues. One is waiting times at emergency departments, specifically Altnagelvin, and the other is mental health waiting lists. So the target is that 95% of people that attend an emergency department are either treated, discharged, or admitted within 4 hours. And the latest data for Altnagelvin was around 42%. So the 95% target was missed by an absolute mile. And in fairness, no type 1 emergency department across the north was anywhere near target at all. But Altnagelvin was the second worst in the north after Royal Victoria. But there are emergency departments across the north which are busier than Altnagelvin that get higher percentages in terms of people being admitted, discharged, or treated within 4 hours. So my first question would be, what is it going to take to actually meet that target of 95%? Because people are frustrated when they have to sit in emergency rooms. I know I sat there last year with a family member for about 9 hours, and it was really, really difficult. So that is a challenge for the person that needs treatment, and it's a challenge for the people along with them as well. My second question is about mental health waiting lists, and I know I've asked this previously at previous delegations. Massive improvements have been made in the last year regarding mental health waiting lists. In terms of children and adolescents, the target, there was a massive improvement over the last year. The waiting list went down and down and down. It was about 100 people waiting to access the service over the 9-week waiting time, but that has crept up in recent months, and there are around about 400 young people waiting over 9 weeks to access the service. In terms of adults waiting to access the service, again, massive improvement compared to last year, but the numbers have started to creep up again. And the real difficulty in the Western Trust regarding mental health waiting lists is regarding psychological therapies. There are nearly 1,400 people waiting over 13 weeks to access psychological therapies. And I'm a counsellor about 2.5 years, and it has grown every single month in those 2.5 years. And it has just continued to grow and grow and snowball. And nothing seems to be getting done about this at all. So my question regarding those 3 aspects of mental health waiting lists is, what are the barriers to actually delivering on the target? And specifically around psychological therapies, what is the Trust going to do differently to ensure that people get the support in a timely manner? Because you've shown previously that inroads can be made in adult mental health, inroads can be made in children and adolescents, but no improvement has been made at all in psychological therapies. Thank you.
Thank you, Rory. Councillor Riley Martin, please.
Okay, thank you, Chair, and thanks to Teresa and Bob for coming along here today. I appreciate that I'm not a member of the committee, so I'll keep my comments brief, Chair, but people may be aware I work for the Alzheimer's Society, so it'll be no surprise, I suppose, that some of my questions are directed towards you, Bob, in relation to the presentation that you made. You pointed out, rightly so, that there's been a lot of media interest this week, specifically on the domiciliary care issue. Our MLA Mark H. Durkin was on radio this morning talking about the pressure points within the healthcare system and the importance of the staff in that system being recognised for the support that they do and the tremendous job that is provided to the citizens that we all serve. It's also worth pointing out that an awful lot of people provide care in an unpaid capacity, and by doing so provide a huge amount of support to the individual, but also then to the healthcare system by providing that care but not getting a payment for it. And it's the loved ones of people who are in receipt of that type of personal care that really are at the foremost of my thoughts and comments here this afternoon. I don't expect the Trust to speak about individual cases, but I have seen and heard the stories of people who are in hospital and are unable to get home again, and the stress that puts the family under, because they want their loved one at home, and they're worried about the fact that when the person is in hospital for longer, that they're more at risk and more susceptible to developing other comorbidities, and also then suffering falls and accidents that may not happen when they're at home. So any indication and any additional information you can give in relation to how the Trust are planning to get people discharged from hospital as soon as they're ready would be appreciated. I think in relation to some of the other points, I know that the Trust and I'm sure all the trusts across Northern Ireland are looking forward to the multi-year budget that the Finance Minister is indicating that he can do, because the lack of a multi-year budget has been one of the reasons why the Minister of Health has said that he can't implement some of the reforms that are necessary. So any indication from the Trust here about what a multi-year budget allows them to do, I think would be useful, especially in the reform of adult social care. And the final point, Chair, I wanted to make in relation to the difficulties that are in the healthcare system at the moment, specifically in the Western Trust. We have over 350 people waiting longer than 9 weeks for a diagnosis appointment for dementia. That's really important because the number of people that are waiting for that service can only get the access to the services that they require once they've got a diagnosis. So any indication about what the Western Trust can do to reduce that waiting list would be appreciated. In comparison, in other trust areas who were facing similar issues, they were able to get the waiting list down by doing dedicated specific appointments for dementia diagnosis rates, and I think that is something that each of the trusts will need to look at. So any clarity that the officials can bring in relation to that would be appreciated. Thanks very much, Chair.
Thanking you, Martin, Councillor Riley. And coming back to yourselves, Teresa and Bob, and just to note, it's in the chat box there, Councillor Sandra Duffy has declared an interest. Her husband, Kevin, is a trust employee. So if you come back to yourselves, Teresa and Bob, please, and them first three speakers. Thank you.
I have, I think I've got this right. I've 7 questions coming out of the three speakers. And it may well be that it would be helpful in order to manage time that through Oliver we send on to council members some further briefing information, which we do use from time to time to provide members with more details, elected reps and others on some of these issues, because there's huge amounts of work that are going on and some of the points that have been mentioned by councillors. So in terms of your first question, Councillor Kearney, are the same staff being used in COVID wards? Bob would like to comment on that, but just to say more generally, that we do have a very extensive programme of support for staff across all of our services, not just those who work in COVID affected wards and environments. And that spans obviously our occupational health services within the Trust, but also a whole range of innovations that we have put in place to provide further support. So we have online support and training tools through our Twist, what we call our Twist West portal, and that provides handy tips, access to online materials, and supportive messaging to staff. We have a range of psychological support for staff, and that goes across from crisis support. So in a ward, for example, say ICU, where someone has died who has been nursed for a long time and the team is very affected by that, we can actually go in after the event and provide crisis support and response to a team that are particularly affected. We also work with teams who are under strain, and we provide individual one-to-one confidential coaching and actually a helpline as well, so face-to-face, remote and through a telephone helpline. So Chair, a whole range of supports for staff, and I would want to stress that. There is a short, probably a couple of pages, Oliver, that we have just describing that, and it might well be useful to send that material on to Council, just to give you an insight to the efforts that we have made to support staff in this, Chair. So I would offer that to you. And then I'm going to hand over to Bob, who can come back to me when he's finished on some of the other areas around anything else on COVID wards and support to staff, Bob, but also the mental health crisis in ED, the neighbourhood nursing issue, and anything you want to say about bank and agency as Director of Nursing, Bob.
Thank you, Teresa. And to council members, thank you for your question. So for Councillor Tierney, the question you asked about do staff who work in COVID wards rotate, and the answer is that the very nature of COVID specific wards and including intensive care is that we have mainly respiratory nurses and ICU nurses who have that skill set. So they don't rotate unless they ask for an opportunity to do so. we're more likely to rotate other staff in, such as from theatres to ICU, to support the teams. And they have been tremendously loyal and resilient. But as your question is clearly and understandably asking, the supports that Teresa's indicated have been readily utilised in those areas, and we, on an individual basis, will continue to work to support them. And on the second question regarding people who attend an emergency department in a mental health crisis, it is a key area. You're quite right. One of the first things I would say in a very busy emergency department, mindful of Councillor Farrell's question that I'll come to, there is no easy way to create a separate area for a person with a mental health situation, but it is something that ideally we would like to do, but environmentally we do not have that ability just now. So we focus on the initial support and the appropriateness of privacy, dignity, and as quick a care as possible. And some of the actions that are underway include developing psychiatric liaison, social work support at the front door, and you'll be familiar with the No More Silos piece, which across the region is looking at that, including that area of work. And also, and it has been very well received in the city area there, the homeless health piece. And often a person who is homeless may well have substance issues and mental health challenges, and they are quite often repeated attenders to ED. We've been doing some specific work that you're familiar with through our homeless health programme. So a combination there, Councillor Tierney. And on the district and neighbourhood nursing, yes, neighbourhood nursing is an extension and a development of district nursing, which has always been and continues to be in the place. And you're quite right, Limavady was the first test of change for the neighbourhood nursing team, and all it really means is that it's a self-managing team based on a very strong evidence base, focused on people with long-term conditions or multiple morbidities or more than a number of conditions, and they wrap around that particular patient group, working with GPs. And of course, the Derry area was the first multidisciplinary team in the region, alongside the Southeastern Trust, the GP multidisciplinary team. And so, as you rightly said, we've spread into the city there, and we have funding to put neighbourhood nursing around MDTs in all of the trust area, and that will be phased in over the next year. And finally, on your point, Councillor Tierney, with regard to bank and agency nursing, could be medicine as well, but I think your question is more so about nursing. Yes, I agree. It doesn't make sense to pay a staff member when they also come in, as happens across the region and indeed nationally, on an agency as well. But at this particular time, our first priority has been to adequately staff areas that are dependent at times on agencies such as the emergency department, and we are working to transition away from that model of higher cost, and that would have to be through our own trust bank, having an incentivization that matches what an agency can pay, and that's something from a workforce planning perspective we're looking at. But our first priority has to be patient safety, and if through this current winter we continue to pay a higher cost, unfortunately we will have to, but it's something we would like to transition to. And Teresa, if you felt it was helpful, there's one of Councillor Riley's two of Councillor Riley's questions that I could follow on with, which would perhaps leave you with Councillor Farrell's question on waiting times in ED and mental health waiting lists, and indeed a multi-year budget. Would that be okay? Yeah, I'll keep going. Bob, yeah. I'll keep going, Teresa, for Councillor Rory's question on first of all Councillor Martin Riley's question on people who are in hospital unable to get home. So what are we planning to do about that? Hopefully you heard in my presentation that the board and the department has asked Trust to submit plans for additional capacity in the community. That in our case would include utilising some of our Trust residential beds for people who are delayed awaiting a care package as a step down into the community. And as an interim step down, that I would call that, and also purchasing additional care home capacity to facilitate discharges of general or dementia nursing into the community. The challenge for of course these care home providers is the same as ourselves in terms of workforce availability, and they're very understandably concerned about COVID risks coming through into their areas as well. But there is work, Councillor Riley, underway to try to put in additional community capacity this winter. And then finally, from me at this point, you mentioned the target for people waiting for a dementia diagnosis. We have slipped a little, having made good progress. And in our last report to Trust Board, we had made progress in the previous month, but overall the number is, as you say, over 300, and the challenge through the whole of the last 2 years has been multifaceted. Seeing a person in their home who has a memory challenge has been difficult from a COVID perspective initially, but also from a workforce perspective, given the challenge of staffing. And the Western Trust has the least resilient mental health services for older people medical workforce. We have, as you I think know, put into place some memory service nurses. We even one person who left the job, as was the case, has a significant impact. We're looking at additional ways and means of support to enhance that model of memory clinic assessment. But it's also balanced, Councillor Riley, against risk of in people who need an inpatient bed plus follow-up review. So the workforce challenge we have is combining to assess risk for people needing a new diagnosis, a review, and indeed inpatient facility. And that combination is a very challenging picture for us, indeed a regional challenge. But we will continue to work very hard to address that. Thank you.
Thank you, Bob. And just coming back to myself, Chair. Councillor Farley asked about waiting times in the emergency department at Altnagelvin, and when we would hit 95% again. So I cannot give you an answer to that, Councillor Farrell. The last time we were in the 90+% in Altnagelvin Hospital is probably around 2015. My memory may not be entirely reliable, but I'm pretty good on numbers generally. So I can recall very clearly us doing our 100% day in September 14, and the focus there was on unscheduled care at that time. But what I would like to say, Chair, is that the demand on our emergency departments has significantly increased in recent years. And in Altnagelvin, we are commonly now at seeing over 200 people a day, over 100 people a day in Southwest Acute Hospital. And those are very significantly higher attendances than we would have seen 5, 6, 7 years ago. We also have, certainly within Altnagelvin Hospital, not within SWA, but within Altnagelvin Hospital, a very constrained emergency department footprint. And that is why at times, and Bob has explained the issue about people attending in mental health crisis, it is extremely difficult to avoid a very congested department. Other than that, we all talk now, Councillor Farrell, about flow, unscheduled flow. So we know that ensuring that emergency departments work well and people wait a very short time is really around the flow of people into and through our emergency departments, but importantly, the length of time they stay. and how quickly they can be discharged, either through a non-complex discharge or more commonly through a complex discharge process. And all of those areas create a lot of complexity, not just within our own trust emergency departments, but in the emergency departments across Northern Ireland. And that's why during last year, the Minister announced a new programme of work for unscheduled care called No More Silos. And we in the West have our own No More Silos programme structure, where we work collectively, particularly with our GP colleagues, on a range of 10 key actions. And those actions revolve around that issue of flow. So when people do attend emergency departments, are they able to be put on a pathway which ensures that if they need to be admitted, they're admitted quickly and discharged quickly and appropriately. And if they don't need to be admitted, that they can come and have an intervention or be seen as part of our ambulatory pathways, so that very quickly that they can be discharged again and go home. It's a very significant programme of work, Councillor Farrell. It would warrant a proper and separate presentation to Council, and we're willing to and absolutely happy to offer that if you wish to take it as a Council as one of your meetings in the year ahead. You did talk about mental health waiting lists as well across CAMHS and psychological therapies. And again, the whole area of mental health care, as you know, is a very significant focus within Northern Ireland, and the Minister has launched the Northern Ireland Mental Health Strategy. The issues around, you spoke about barriers and issues around why waiting times have increased and the numbers waiting have increased, really are around 3 issues, Councillor Farrell. They're around the fact that we do have what we call in the lingo a demand and capacity mismatch. We have more demand than we have resourced or commissioned capacity within our services at this time. So the service has not grown as the demand has grown. We have a preponderance, particularly now in this part of the pandemic, we have a preponderance of crisis referrals, which those services obviously need to focus on. And that means that planned referrals or more routine referrals, unfortunately, are deprioritised or reprioritised. And that does affect waiting times and numbers waiting. And we also have workforce gaps and workforce pressures. And again, our own staff and staffing complement are not immune to COVID and to the pressures and stresses of COVID on their own health and well-being. So we do have gaps and vacancies and absences within those services that affect our ability to be at full capacity. You referred to things improving in previous years, and absolutely that has happened. And we have received support in previous years to undertake, particularly in psychological therapies, what we call waiting list initiatives, so that we can do short-term interventions. And just last month, perhaps it was September, I think it was September, Chair, we did get commitment from the Health and Social Care Board to have additional in-year resources for psychological therapies. So we are working through and planning how they will help reduce some of the waiting lists, particularly within, as I say, psychological therapies and some of our other mental health services. Finally, the question from Councillor Riley about multi-year budgets. We are very used to in the health service working with a single year budget. It certainly creates difficulties when we get into a situation where we are setting up services or progressing services using only, what we call non-recurrent funding. So funding that is only there for that year and can't be committed to beyond that year. So you can imagine when we're trying to innovate or introduce new services or respond to service pressures, trying to staff up and establish new services with only non-recurrent resources gives us additional challenges. attracting staff is a difficulty and stabilising services is a difficulty. So we're absolutely fully supportive of the ambition to move to multi-year funding, and certainly as the chief planner in the trust, it will certainly enable us to take a more medium-term view, a more strategic view of the things that will improve and help our services, particularly those issues around waiting lists. And I think that will be absolutely fantastic for our population. Chair, I hope that's dealt with what I think are all of the questions so far.
Thanking you, Teresa, and thank to yourself, Bob. And obviously, I've a further 6 speakers, and some people may want to come back with supplementary questions or queries. But if I can move through the speakers, of the next 3 speakers I have is Councillor Boyle, Alderman Devaney, and Councillor Ferguson. So, Michaela.
Thank you, Chair. Thanks to Bob and Teresa for presenting here today. And I also, too, like others, want to convey our thanks to you and your staff within the Trust for the work that you have been doing over the past few years since COVID, and the work that you will continue to do throughout the winter pressures, and trying to, I suppose, put some meat on the bones of what's happening out there at the minute. And I suppose just a lot of my questions answers have been to my questions has been covered, but just in terms of the pressures and the situation with care packages, and I know it has been covered, but I do believe, I mean, I think today the figures stood at 1,600 people currently waiting for a care package. And just, you know, I would like to know how many of those are in our trust, within the Western Trust, how many families are still waiting on care packages and for their families. Obviously, there are currently not enough care packages being made available. I do believe the Department of Health needs to bring forward its plan to reform social care, particularly with regards to the building of the social care workforce. It needs to bring forward those plans kind of immediately, including plans for a living wage for staff, and to outline what it truly costs to deliver care right across all of our healthcare trusts. I welcome the conversation in terms of care homes waiving fees. I think this certainly should be looked at, the emphasis of the true cost of care to understand the top-up fees. Also needs to be dealt with and looked at. The lack of available carers is another example of the lack of workforce planning that has been felt right across all of the health and social care sectors. And, you know, I know that conversation in terms of waiving fees is out there today, and that has to be welcomed. I do believe waiving fees for care home packages, or for care homes until a package is in place, has to be looked at as a temporary solution, so that people are getting the care that they need. Additional capacity and community in the step down interim packages are also, you know, need to be looked at. And I know, Bob, you alluded to that, but that's work that needs to happen ASAP. I just want to kind of touch too on the ambulatory services, and I know it's out of your control, but just as recently as yesterday, I had a constituent contact me who has to go for cancer treatment 5 days a week for the next 5 weeks, and he is finding it very difficult. He has very limited mobility and gait, and he is finding it very difficult to get access to transport to the hospital for his medical treatment for cancer. So that again is something, and as I said, it's probably outside of your control, but it's affecting your patients. So I do believe, you know, that is something that we do really seriously need to look at. And I do take, you know, pride in saying that we do have a fantastic ambulance service right across the north, and there are others in that sector as well too, in the private sector, that are helping to deal with the capacity and resourcing of that at the minute. So I have to commend all of those that are trying to do that and under the extreme pressures that they're facing at the minute. So just to close, just that I do believe that the minister does need to bring forward a strategy at the minute. I don't believe there's any evidence of him doing that or the department in doing that. So I think that's very important to really evaluate the true cost of care and what is needed right across the workforce. So again, once again, thank you for coming this afternoon and taking the time out of your busy work life to do this at this time of the year, particularly with the winter pressures. And I, like others, do what we can in our own communities to keep our communities safe. And I can't emphasize enough the booster vaccine and everybody getting that. And I think it's the pressures with the flu and everything else, and combined, it's going to be a very stressful 3 or 4 months ahead for the trust and for the Department of Health. But we all can do what we can to ensure that people's needs are met. Thank you, Bob, and thank you, Teresa.
You, Councillor Boyle. Alderman Devaney Morris.
Thank you, Chair, for allowing me in, and I kind of just say thank you to Teresa and Bob for coming along with their presentation and update here today. And I just want to put on record the DUP's party thanks to all the staff that has carried out very, very good work this last 20 months, and hopefully and will continue to carry out as we move on with this pandemic. And as we all know, we're heading into a very difficult time now as we come into the winter time. And as everyone understands, this is unprecedented times, and look, it's difficult. I just want to touch, just put on record, look, my support for everyone having the vaccination. And we heard yesterday of an issue at schools about anti-vaxxers, and we condemned that, quite rightly so. But I want to just ask the question. I've heard, I don't know, I think it was Bob said that there was maybe some difficulty with staff getting the booster vaccine. Just listening to the media earlier on in the week, you probably know where this comes from, that there was concerns in around maybe 20 to 25% of health service staff has no vaccination yet. And I'm just wondering what your thoughts are. Would the figures be as high as that? I would like a wee update on that. And when we look at domiciliary care, once again, it's been well rehearsed here. There are difficulty in getting people back out from hospitals, whether it be through homes, into their own home again because of packages. And I do appreciate there's amount of work being done on that. And I do believe that there is more to be done. Just want to touch base again on the agency staff. I've mentioned this on numerous times. It puts serious difficulty on the budget that the health service has to deliver. When you hear of nurses, and I've heard this figure, and I've nothing to back it up, where nurses are earning in around £20 per hour or thereabouts, a little more or whatever, and you hear of agency staff can earn £40 per hour, and maybe and this was in the media, that could earn up to £50 an hour. And I do believe, I think as you said, Bob, again, there has to be an incentivization there for staff to sort of bridge that gap, to maintain staff and have less staff leaving and picking up agency staff. The other thing that I would just like to say as well, look, I do believe the Health Minister and the Health Committee have to come together. We have to put a strategy together in how we move out of this and deal with all the issues. And the last one I just wanted to speak on or just mention was through the media again, we've heard some doctors saying we're very close to lockout or closure in some departments. And I know our Health Minister has came out and said that it doesn't believe that is it's inevitable that will happen. I just want to know what your thoughts are and around that, because I know you are running at very high levels, high percentages. How close would we be until something like that could happen? And what happens if that emergency case does happen? But once again, thanks to all the staff for the good work.
Thanks, Morris. Councillor Ferguson, Rachel.
Thank you, Chair, and thank you, Teresa and Bob, for coming today. And firstly, can I give my party, the Alliance Party's thanks to yourselves, the healthcare staff from the Trust staff, for everything they've done pre-COVID, during COVID, and will continue to do. Councillor Farrell touched on one of my queries around emergency department waits. And when you speak with some of the GPs across the board, they'll tell you that they're finding it extremely hard that they don't have that direct access to the wards and having to send patients through the emergency department. I myself in the last 12 months have been up 3 times with a sick family member with one wait over 24 hours to allocate a bed. And you know yourself, the emergency department has huge pressures, and you can see how hard they're really working, but that care can be limited in comparison to what can be given in the ward. I note in your plan that there is to be 4 direct beds to GPs to come available, and that potential is redirect 120 patients per week away from the emergency department. There's also one there for the ambulance service, but it states that currently cannot be put in place because of funding. Is that still the case with the new funding packages, the new funding given to the health department? I'm just wondering, and is there a potential to maybe grow and expand on that, because that seems like a really responsible and reasonable action to kind of take to try and take the pressure away from the emergency department. And then my second question is around the waiting list overall. I had one query in particular where a patient was presenting with one issue, but to be transferred over to a consultant, they had to have an investigative procedure done. But that investigative procedure they were then told was a 2-year waiting list. So the problem was then they're waiting 2 years for that procedure and then possibly a further wait for the consultant. Is there work to be done where possibly whilst waiting for that procedure that the patient could still have access to that consultant, because there's a number of other issues with, say, that condition, not necessarily just the procedure for the investigation. But again, my sincere thanks to yourselves for coming today. I know it's extremely busy and it's not easy answering all our questions, but thank you very much.
Thank you, Rachel. And back to yourselves, Teresa and Bob, please.
Thank you, Chair. Chair, I think some of the issues have been covered by Bob, but I'll come to Bob in case he wants to make any further comment on particularly Alderman Devaney's questions. Could we start, Bob, with Councillor Boyle's questions about pressures and care packages and the numbers waiting? I think you did do that in your initial presentation. And any other comments that you want to make on reform of social care and workforce issues associated with that?
Yes,
and then come back to me, Bob.
Thank you, Councillor Boyle. Yeah, I did say in the presentation that the number waiting in the Western Trust at the most recent count, and this was reported in the media yesterday, is 141. And you mentioned the overall total as well, in and around about 1,500 as such people who are waiting for their package of care. So 141 in our area, which is the lowest. But I do agree and support your points around the longer term planning framework. Now the minister has supported the putting into place of the social care fair work forum. And indeed, there is a review of adult social care, and your point around the true cost of care is very much part of that work. I think for all of us, it just needs to happen at pace, and we'll very much play our part into that. And Teresa and Councillor Devaney's point around the vaccine, I'll not comment other than to say that we will all continue to promote the vaccine, whether it's a first jab or a booster, because it's fundamental to the resilience of health and care services going forward. So thank you, Teresa, and back to yourself.
Thanks very much, Bob. Councillor Boyle, the issue around ambulance services, I'm not sure whether or not that's an individual patient issue that we could look at separately. But you're absolutely right. There's been enormous pressure on our ambulance services, and just as we have had our own workforce pressures and sickness absence, as you can imagine, that also affects our ambulance service in Northern Ireland. And in those circumstances, just as we do in the Trust, the ambulance service absolutely focuses on their 24/7 and crisis ambulance services. So patient transport, the more routine work, unfortunately, does become a casualty of that. I wouldn't be up to date on the position with ambulance service at the moment, but I would have hoped that there would be either community transport or other transport avenues that the individual or someone who advocates for the individual could have explored through community and voluntary sector or the rest, Councillor Boyle, to try and support this gentleman. But if that's not possible, please do send on the details and we'll try to have a look at it or pass it on to the ambulance service. On the vaccination point, there is no difficulty with our staff getting the booster vaccine. Alderman Devena, we have been running clinics from hubs and also through mobile arrangements outreaching into our facilities since end of September, and staff they're full, so staff are coming and getting their booster vaccine, or if they have not been vaccinated, are being offered the first vaccine or indeed completing their vaccination at second vaccine. So we're not aware of any difficulties with staff accessing the booster vaccine. Councillor Devine, you also referred to doctors referring in the media to the fact that we were close to lockdown or closure. I'm assuming the reference there is to our emergency departments. And we have had obviously very significant pressure in our emergency department and in other emergency departments across Northern Ireland. And all I can say is not to deny that, because the pressure is there and it is very real. However, we do have systems and processes within the Trust to respond to emergency situations and peak pressures. And those are part of our planning processes. So at points in time where we have very significant peaks in pressure in our ED department, we have what's called our full capacity protocol, where we work collectively across our hospital, both our emergency department and our wards, to move patients from ED into escalation spaces across our hospital. And we then have more longer term emergency planning and business continuity arrangements that we operate at times of very significant pressure in our hospitals that really are there to expedite the flow of patients, both into our wards, but also out of our hospitals and into community or home settings. So that's an issue that we are very alert to and aware of, and we have response plans that are there to activate when we move into those situations. But it's a very real concern and it's a very real possibility for us. And we certainly are not denying any of the concerns that our medical or clinical colleagues or indeed our managerial staff would have around the pressures as we move into the winter period. Councillor Ferguson, your question about GPs and direct access, I suppose, is linked, because as our hospital fills up, the areas of our hospital which we would ring fence to enable ambulatory access from our GPs or indeed direct access towards are very difficult to access. So that's part and parcel. It's an impact of the pressure that we're seeing on our inpatient beds. And you referred to the direct access beds and the No More Silos funding. And that funding, I believe, has been received. I am not 100% on that, but we are not concerned about the funding being received for support to those 4 beds. And we have bid for an expansion of that. So we will continue to progress discussions with the Commissioner to see whether other funding could be provided. And on the final question, Councillor Ferguson, around the transfer between consultants and diagnostics, I'm afraid it sounds pretty complicated, and it would be, I think, probably just warrant a look at the individual case. If you want to send that information to Oliver, we can have a look at it. I don't think I could respond to just the complexities of that at Council today. Thank you, Chair.
Thanking you again, Teresa and Bob. I have 6 further councillors, and the next 3 councillors is Councillor O'Neill, Councillor Harkin, and Councillor Lowe. So, if Maeve, please.
Thank you, Chair, and thank you, Teresa and Bob, for coming on the council today to present. It's been really valuable to hear what you've had to say, and I just want to start by saying that staff really have done and are continuing to do an incredible job through kind of what feels a never-ending pandemic, but also, like, I think probably the most challenging time that any of us have ever had to work through. And we really can't underestimate the pressures that staff are under, and I don't think any of us are looking forward going onto this winter, because I don't think those winter pressures have well and truly started, but it will come. And I agree with Teresa and Bob in that the main challenge is the workforce. So that's like having enough, but also looking after the current staff that we have. And the morale is low, and it's really hard to kind of work with and with patients at a service that you feel has let patients down from being on waiting lists for far too long, or not having the home care to get them out of hospital, and that's tough for staff. And I feel, I don't know how much more wiggle room there is, like it feels like our capacity is bursting, like, new wards have opened, and so there has had to be coverage of those wards as well. And I know, Bob, I think you said we were at 93% capacity at the moment, but I wonder what that is kind of minus the wards which aren't supposed to be overnight wards, which now are acting as an overnight ward, and other wards that have been opened. And Councillor Tierney had mentioned about the number of staff who have left, and have instead joined an agency, and what's happening now with those staff, they know that they don't have the same terms and conditions, which have been hard fought for and hard worked for, that the Western Trust gives, which are actually really good terms and conditions for staff. And now a lot of those staffs are getting private health insurance, which is further exacerbating the kind of privatized health model. And I think one of the main issues, and I suppose it's a question to ask of Teresa or Bob, is around flexible working, because I know on the ground that's a big issue for staff, is around flexible working, because I think staff have felt the challenges of work-life balance over COVID, with caring responsibilities, not just for children but for also other adult dependents that staff might have, because it's been a really tough time for so many people and families. And I know there had been talked about a flexible working policy, a policy that has a yes first approach rather than a no approach, but in practice on the ground it doesn't feel that's happening, and I know that is a reason that a number of staff have left. And I don't know if there is numbers kind of based on other years around the number of staff who have left the trust in comparison to other years, and if you have that data, I think, like, we can't not say that the pressures that we're facing in the health and social care service are from decades of underfunding, and decisions to privatise certain aspects of our services that have come from the Stormont executive, and also the gap from the Stormont executive not sitting, which left our health and social care service with no direction. And we talked about no more silos, which like many other initiatives had like a really good ambition, but it was my understanding that only a fifth of the funding for that actually came through, and everybody had to go back to the drawing board in terms of looking at that project. So I think the Stormont executive have a lot to answer for when it comes to the current pressures that we are facing on the ground, and this is the perfect storm now in the health and social care service. And like, a lot has been said about domiciliary care, and like, from my understanding, like, I know the pressures that domiciliary care is having and not being able to get patients out of hospital, but a lot of the workforce issues there are again, per terms and conditions that staff who are working for private providers have. Like, you know, we have domiciliary care workers who work under the trust and who, you know, have expenses for mileage and, you know, and who have very good terms and conditions, who have sick pay, whereas the private providers do not provide those same protections for staff, but also the same rates of pay, where even the journey between patient's house to patient's house is not even covered within their wage. And so, like, are we looking at increasing the number of domiciliary care workers that the trust employs to try and fill some of those gaps, or are the solutions purely to give more money to private providers? So, like, I would like to know that question. And you know, on the vaccines, I've had my booster vaccine, and I really appreciate, you know, having that privilege of being one of the first in our communities to get it as a employee of the trust. So I really value that. And the last question, just is around the early medical abortion services and the trust. Currently, you know, there is no EMA service. It's been absent for quite a number of months now. Which is, you know, placing women and pregnant people in a really difficult situation now in our trust, and they're having an unequal access to a service that, you know, other women and pregnant people are able to access in other trusts. So I'm just wondering, like, you know, what are the challenges there? Like, why has the role for the health professional to run the EMA service not been advertised publicly? And, you know, I think this is a real priority, given now that this is something that has been made legal for women and pregnant people to access. Thank you.
Thank you. Maeve, Councillor Harkin, Sean.
Thank you, Chair, and thank you for your comments, Maeve. As somebody that works in the health service, I think you've got a very good insight. I think some of the SDLP councillors on here have lost interest because they're certainly not listening to you. So can I thank the Western Trust representatives again for being here and taking the time to go through this with us. I know that your schedules are probably very, very demanding, and I know that the health service right now is getting hammered by all sorts of different pressures that we don't actually have the time to really fully unpack in this session, even though it is quite long. But I guess as far as people before profit goes, like, we want to thank you and thank the immense efforts of our health workforce to kind of continue to try and deliver care under very, very difficult circumstances. And I think we as a council and as councillors need to do everything we can to help the health service right now. And I suppose part of that is continuing to make the argument to encourage people to get vaccinated for COVID, whether that is members of the public who are still not convinced, or people who are in a healthcare setting. I think we need to be persuaders and trying to win people to over to the science that says getting the COVID vaccine is the best protection for yourself and for people around you. And I think we have to continue to do that work. And you know, I would also encourage people to get their flu vaccine, which I got myself. And so that is something I think we can do as councillors to be public advocates for the health service. We've talked a lot about the different pressures, and I'm not going to go through them all again. The one thing I will say is health workers in our health service have, again, I mean, there's a lot of thanks, but they already know that they are getting they're going to be offered a 3% wage increase, and that the executive parties have already basically signed up for that. And this is going to cause more demoralisation of our health service workforce, which is very, very disappointing. And if it does come to a strike, it is going to be on the executive for having caused it, because already I can see that there's been attempts to begin to demonise health service workers for even talking about taking strike action. So I think that if that does happen, it'll be the fault of the executive parties that are ready now to impose on our health service workers a below inflation wage increase. of 3% when inflation's running at nearly 5%. So that's one thing. And if you can take that message back from here to our health service workers, I would appreciate it. The second one is just about domiciliary care, because again, we've heard people in here talking with surprise as if they've just found out today that domiciliary care workers have substandard wages, have terrible terms and conditions, and this has obviously led to a crisis now of a shortage of staff, which means it has a knock-on effect of putting immense pressures on the health service to deliver packages, and it's putting people in tremendous hardship. So a lot of people were taking their frustration out on the health service and on the Western Trust and on the people who run the Western Trust. But who has made these decisions that actually led to the privatisation and the outsourcing of the domiciliary care sector? That's all to do with Stormont. This is Stormont legislation that has set up a situation where companies, corporations run this sector for profit and don't pay their workers a decent wage and have terrible terms and conditions. And the Stormont executive parties have simply turned their back on those workers for many, many years and have turned their back on the trade unions who've tried to do something about it. So coming in here today to say, oh, isn't it terrible that these workers aren't getting paid a decent wage? I mean, come on. This is like Rip Van Winkle waking up after discover there's been a revolution in America. It's very, very frustrating. The problem here is that the executive has created a context with privatisation, with outsourcing, with deregulation of this sector that is actually now hurting people dependent on care, and it's putting again tremendous pressures on our health service. And again, and people are walking away with big money. People are making huge profits out of this, and that's clear as day. While workers in the sector suffer. So look, I think the solution is that we have to bring domiciliary care back into public control, back into the health service, where we can attempt then to actually increase wages, the living wage, where we can attempt to then improve terms and conditions for workers. Otherwise, there is not going to be a solution unless it's complete trade union density right across the sector, but employers are going to resist that very, very aggressively, and that's why we're in this situation right now of having terrible terms and conditions. So we believe as People Before Profit that domiciliary care should be in the health service, and I think that would lead to better terms and conditions for workers, mostly female workers. It's overwhelmingly women who are domiciliary care workers, and they're being exploited because of their willingness to care for other human beings and not being paid properly. And it will also improve care for those that need it. It'll improve domiciliary care for people who are dependent on it, and it will ease pressures inside the health service. So that is something that we think that the executive should be taking immediate action on. And look, we've talked recently about Capita and its role in terms of privatisation and the damage it's done to people. We've talked about care home bosses and their treatment of workers and their people who are in their care. And this has a lot to do with privatisation. And so here we are again now, another crisis, a work shortage, because people are not signing up for terrible pay, for terrible conditions, knowing that they're given the kind of challenges of the job, which are not easy. So I think that this is on the executive, and I think we have to point the if anybody's frustrated, I think we have to point in that direction. So I have a proposal that I would like the Health Committee to vote on tonight, and that is to call on the executive to bring domiciliary care work that's right now in the independent sector, to bring that within the health service again. So I will send that on now, and hopefully we can discuss that after the meeting is over. Thank you, Chair.
Thank you, Sean. Councillor Lowe, Patricia.
Thank you, Chair, and thank you, Bob, and thanks, Teresa. And you'll be glad to hear I'm not going to come out with a party political broadcast. But no, I do share the same concerns around the domiciliary care. It is nothing new. I don't believe that given those workers the extra £2 is going to be a long-term fix. But I do think that you know, something needs to be done to resolve this situation. Obviously, the main issue is around terms and conditions, so that's something that you will be talking to the providers about, I presume, in the meantime. Just a couple of wee things, just to finish off on domiciliary care. I am aware that one provider sent out letters to some of its clients during the week about actually cutting their hours. Now, I don't know what input the trust or the social workers had on this. I'm glad to say it is now resolved through pressure of families, but that's something too which was very concerning to me. I would just like to ask, of the 141 waiting and care packages to get out of hospital, is that people solely looking to get home care packages, or is that a mix of people waiting on bed care too in care homes? So you mightn't have that information to hand, but you can get it to me at a later date. I would like to ask, in your opinion, and I think I have asked this before, we all see the waiting times in A&E and the influx to out-of-hours services. For myself and a lot of the constituents I represent, there has been increasing difficulty, frustration in trying to get GP access. And maybe not even being able to get a telephone consultation on that day or the next day after waiting the phone for a half an hour. Do you see this as a reason why a lot of people are turning up to out of hours and the A&E department? Just a thing on hospital beds. I know this because of a few personal matters that relating to people being let out of hospital. They maybe would have got a discharge from the consultant doctor that morning, 10:30, 11 o'clock, but didn't get out of the hospital maybe until sometimes 7:30, 8 o'clock at night. And that was because they were waiting on medication from the hospital pharmacy. Many times during that day, those patients would have asked, is the medication there yet? Is the medication there? And in some cases, it hadn't even been ordered. And I know in other cases that they went on home and then returned back to the hospital to get the medication. But that is not readily offered up front. And we do know that, you know, there are people lying in A&E waiting in beds where there's a bed upstairs where people have been discharged to go home, but they're still using that bed because they're waiting on medication. So I think that's something that needs to be looked into. There needs to be a better way of working in that line. And this is another question which I appreciate you probably won't have the answer to, but concerned about the time wait, especially for red flagged patients to get certain urgent tests done. And that would be across all I suppose, departments. Could you maybe get me the figures for the waiting time to get the test that they need when they're red flagged? So I think that's all. Thank you very much.
Thank you, Patricia. And if we could come back to yourselves, Teresa and Bob, please.
Thank you, Chair. Just given the time, we'll keep the responses fairly short, and there may well be information that we could supply on separately. So, Councillor O'Neill, just starting with your own points, you are right that some of our ambulatory wards do at times have very significant pressure. They are flipped to be overnight wards, and again that does affect flow. So that's you're just recounting a fact, and one of the valves that we use, the pressure valves that we use within our hospital sometimes to deal with difficulties with flow and pressures in ED. You asked specifically about flexible working, and the trust does have a flexible working policy, and rigorously operates that policy with staff. I'm sure there are individual cases where there have been difficulties, but the trust would be very proud of its reputation for flexible working. I think during a pandemic, it is particularly challenging to facilitate all of the family arrangements, but obviously we have to redouble efforts to do so because people have their own family challenges. I do not have, Councillor O'Neill, information on the numbers of staff either who are accessing the flexible working policy of the numbers of staff who have left the trust. And I think it would be very difficult to get due to flexible working difficulties. But certainly, Oliver, we can see whether any information is available on that. You referred to domiciliary care in terms and conditions, and maybe I'll come back to Bob just finally as we wrap up to see if there's anything further he wants to say on that. You also referred to the EMA service, Councillor O'Neill, and that is there is no service in the West at the moment. You're correct. We are not able to resource that service at the moment, and there is a commissioner-led planning process that is underway so that a service can be commissioned into the longer term, and that has not, the outworkings of that are not yet available, so that service is not yet commissioned with the trust or with any trust. In terms of Councillor Harkin, I welcome very much your comments, Councillor Harkin, about vaccination and that our public representatives need to be persuaders. I'm not able to comment any further, Councillor Harkin, on your comments in relation to pay policy and again on domiciliary care and any outsourcing policy. They are Department of Health decisions in previous times and currently. Councillor Logue, again, you commented on the domiciliary care issue, and you've asked a specific question of Bob around the mix of those that are awaiting care packages, so maybe we can come back to that. And you referred to out of hours services. We do not manage the GP out of hours service in the Western Trust. Some trusts do manage GP out of hours, but in the Western Trust, this is managed by Western Urgent Care. So the Trust don't have any responsibility for Western Urgent Care. And you'd asked just an opinion, Councillor Logue, about is it a reason for people turning up at ED? We're not able easily to determine that just by our data collection systems in ED, Councillor Logue. So it's difficult to tell that, but certainly the people who wait a long time in our ED are people who have high acuity and are waiting a bed. They're generally not people who are suitable for seeing GPs and being treated by GPs. Finally, you asked, two further questions. You asked about hospital beds. And again, maybe Bob would talk about the regional work on discharge, home for lunch, discharge to assess and nurse-led discharge. And then you asked about the time waiting for red flag patients to receive their diagnostic tests. I suppose all I would say in general terms, Councillor Logue, is that anyone who's suspect cancer or diagnosed cancer is part of a process to prioritise right across trusts in Northern Ireland. And the most time critical patients are the patients who are prioritised. But in terms of the factual position, I can ask Oliver to take that offline and seek the information to pass back to Council. Bob, I'm going to come back to you just on the issues around domiciliary care, care packages, and then discharge, if that's okay with you.
That's fine. Councillor O'Neill asked, are we planning to increase in-house home care? Throughout the last couple of years, we have worked with both our in-house and our independent sector domiciliary care providers to respond to particular areas of need. So there is always that flexibility option, but contractually, we have no intention at this stage to go beyond the current setup as such. And then it was Councillor Logue who asked about the number who are waiting, and is that solely home care, or is it care home admissions that people are waiting for as well? No, that is only for home care. It'll be a very separate data set for care homes. And yes, you did mention people who are delayed when they're waiting a medication, and that is a factor of for the whole system. In the pharmacy workforce has been hugely challenged as well in the last 20 months. And we are actively working as part of the program that Teresa just referred to earlier in the day, discharge, to ensure that when a person's waiting for their medication, that, for example, it's prepared the night before the prescription and the doctor's letter, ordered and available as soon as possible. So thank you for your questions, and those are very much a part of our prioritization.
Okay, Bob. Okay, Teresa, thank you for that. I have 4 more councillors, and the next 3 is Alderman Guy, Alderman Kerrigan, and Councillor Donnelly. Darren, please.
Thank you, Chair, for letting me in, and thanks to Teresa and Bob for coming here to present today on behalf of the Ulster Unionist Party. You're very welcome. Look, I waiting times at A&E. I've seen the good and bad in the last couple of weeks. Wife fell and broke her foot, and back out again within 4.5 hours. Great. On the other hand, my sister was taken in at 11:30 one morning and was still sitting in the same chair at 9 o'clock the next morning. She was severely ill. She got operated on, and I have to say, thankfully, she's recovering well now. But the problems are still there. When we went up with the wife, A&E wasn't too bad, but when I went in, they took stuff for my sister because I knew they were going to keep her in. There was a standing room only, and that was in all the corridors, all the different sections for X-ray and so on, and all the rest of it. And we do have to look at it as well or not. Is it a problem? Well, and I know you stated, Teresa, that you can't tell from the actual data, but I do believe that the way GP surgeries are operating has some sort of pressure added to the A&E because of it. I know not all doctor surgeries are the same. I have to admit mine isn't. I can't complain about them, but I do get loads of complaints from people who attend all our surgeries. On the domiciliary care side of things, we spoke to a few independent providers in the past couple of weeks, and they believe that a lot of their staff are actually leaving for jobs in the trust care side of it. And they feel that, obviously we were speaking to managements, not the people that own these things, and they can't compete with what the trust is paying and offering. But I agree with Councillor Harkin, this isn't just a new problem. I remember going back probably about 4 or 5 years ago, and our taxi company took a woman to hospital for a full week and a half with a suitcase. They bring her husband out. Every day we lifted her again with the empty suitcase. But he wasn't getting out because there was no care package for him. So this is ongoing. It's got to the stage now where this problem that has arisen recently, where people are seeing their care cut in half. If they're morning and afternoon, they're losing the morning or they're losing the evening or something like that there. This has been coming down the tracks because the domiciliary care, the care, care packages and so on, to me, it has always struggled right from the start. The pay is awful, and there's just not enough people doing it. And again, it's the cuts and so on that have been handed down through the years to all the trusts and from government and everything else. The other thing I'd like to bring up too is that COVID and staff, NHS staff, now I'm not sure, maybe this has changed, maybe it hasn't. Staff that were double jabbed, they come into close contact with somebody, they get a test, they're back at work as soon as that test is negative. But staff that aren't jabbed get their 10 days paid leave. Now, I know it's controversial at the minute about whether staff should be vaccinated or not. I'm double jabbed. I even got my booster yesterday, and I've had my flu jab in between. But I have to say this: I wouldn't, if it was my job, if it was my business, I would not be paying staff for 10 days leave while other staff are exhausted and they have to work on. You know, it doesn't do nothing for staff morale, and I think it's a decision that has to be made. And if people aren't going to be happy, well, so be it. But thanks again for coming on, and that's my views. Thank you.
Thank you, Darren. Alderman Kerrigan. Keith.
Thank you very much, Chair, for allowing me in, and I do thank our team here that have made their presentation and are taking the questions, and I do understand we're taking a lot of your time. I say I know that the health service, when you need it, is powerfully useful, and as I say, I've known that myself. I've had Mowler's Cub, you know, we've had the incident with Air Ambulance. We've been up in the Royal for quite some time there, and as I say, the service and the treatment he's getting, you know, couldn't fault it. You know, powerful the work that's done, and thankfully he's on the road to recovery. So as I say, we've had that, we've seen the cold face of it there. So as I say, it's been an issue, and to be fair, more than likely what you're getting today and what we're getting is you're only getting the issues really when there's complaints. You're not getting a pile of well done. You know, it's only an issue. You know, you could have 100 cases and 95 of them no issue at all, 100%. That's grand, and it's only those 5% that all the noise is made about. Now, I'm not quote those figures, but we just said, as I say, I have an issue here, and I'd probably rather contact you direct about it. Do you have an issue in regards to Rosebud Cottage and in regards to concerns there for respite care? I have a very harrowing conversation there with a lady from Castleberg in regards to, you know, really getting no care facility, no respite at all now, and it has just been told that it's not happening. Someone else has come in with a priority, and her care package is gone. You know, and this lady is dealing with someone that is you know, a child that really needs 2 carers full time, and you know, it's just put a lot of pressure on the mother and the rest of the family. So as I say, I will seek to contact as an email, come on with a wee bit of detail to try and get that squared up. I don't want to go into much more than that, but I do apologize if I ask a couple of questions maybe have already been touched, because I did take a phone call and you were coming in, and I took a phone call from a nurse during your answers there, replies to someone there, and she was one nurse that this was the second one we spoke to today, and giving me a wee bit of a rundown now on their gripes, if you want to put it that way. And I think a lot of them maybe are justified. Some of them now, they may not be all within the Western Trust, to be fair, but I think they're one of them's working full time in the Western Trust, and the other works in a couple of trusts. So as I say, I'll just touch on here. Issues raised with myself is redeployment of staff. And issues with that, whereby the staff that are full-time in some of these wards, more staff have been redeployed in to support them, which is a bit of a benefit, but it's often left then that the staff that are there are kind of redeployed staff may not be properly trained in that issue. And the one that spoke to me is there's redeployed staff but in the ICU who are not properly ICU trained. And there's you know, it's just left that they have to deal with it. Sorry. It's just left that they're kind of in charge of them, and they're trying to keep an eye on them and give them a wee bit extra support and training while trying to manage their own patients. So that was an issue was raised, and mentioned another complaint issue was stated, and there was meant to be a pay increment up to band 6 for ICU staff. I was told, one of the staff members around to me, that she was still in receipt of band 5 payment, and it was promised that they would get up to band 6. So, as I say, a band 6 uplift, but that hasn't happened. Staff shortages, as often mentioned as well, and agency staff been brought on. Staff shortages, both these ladies that have spoke to me today saying they're receiving messages every single day. Every single day they get messages asking them, is anybody available? It's a group message sent out to whoever looking for staff and constantly begging for staff. And if your day off, you're wondering, can you come in? Can you cover shifts? And I know that's maybe it's an ongoing issue right across the health service in Northern Ireland, but it's just that seems to be one there. What another issue was raised, given the COVID and given the issues, it is difficult to try to get any additional training for yourself. You know, this is what was raised, that some of these staff that are working there, they're having to try and assist and help and train others, but they're not really getting an opportunity to go and take on other courses. One of the ladies did say that she wished to transfer to a specialist in an area and to go into day surgery, but apparently she says a lot of these areas now seem to be partially closed and those staff redeployed into the likes of ICU. So she said if she had have tried to get moved to another role, she says she was just told she was going to be redeployed back to ICU where she was working. So there is a concern. Issues with just says lack of incentive and a lot of promises of action going to be taken and maybe financial benefit and this, that, and the other. And a lot of it seems to be issues raised with them, but there's no follow up with it. And a couple of other comments that one of them raised with me was there was potential. Now, again, this one may not be yourselves, but it was raised that there was potential of some wards increasing. There was one she had mentioned about a ward going up from 10 beds to 14. And she says they can't manage the 10, never mind adding additional beds to the ward. And another mention was that there has been occasions where there's meant to be 12 nurses on a certain floor and they've been down as low as 8. And I'm just wondering, are we caught the same extent? Is that a common thing, or is that something that you'd be saying doesn't happen, maybe a one-off? And the last we touch here, I'll touch on it then, was in regards to PPE. And one nurse mentioned, obviously, she works with the COVID patients, and she did say to me that she had been in the PPE and you're in that kit for so long, but you're meant to get breaks out of it and this, that, the other. And she did state that she was in the full PPE gear for over 5 hours on an occasion, and she's no opportunity for breaks or anything else. And I'm just wondering, is that, are there proper facilities in that for breaks, or can people get that? So as I say, those are the issues which I've got there from speaking to NHS, to staff there. I say apologies if maybe you have touched on some of those. I missed a wee bit because I had to take a phone call, but that's where I'm at. But thanks very much, and if you can touch on some of those, it would be much appreciated. Thank you very much, and I will contact with whoever's better, Teresa or Bob, in regards to the other issue raised at the start. Thank you very much.
Thank you, Keith. Councillor Donnelly, Gary.
Good, Chair. Thanks for letting me in. I'm a member of the committee. Look, Bob, Teresa, I don't have a question, but I'd just like to put on record my appreciation to the professionalism and commitment, dedication of the health workers in Altnagelvin and beyond. You know, I have a number of family members who are in the profession, some friends who are in the profession, and I'm under no doubt that it's a very, very, people are doing a great job under difficult circumstances, and there's no doubt that the health service is under attack. I suppose it brings it very, close to you when only recently I spoke to a young man who'd come very, very close to death. He didn't get vaccinated. It wasn't because he wasn't convinced. He just didn't bother. And this young man was very, very badly hurt and is living with the injuries from that. But he is under no illusion, and those around him, that if it wasn't for the professionalism of these professionals, of the Galvin Hospital, that he wouldn't be here today. And I suppose, as somebody who has recently been tested positive for COVID and is currently isolating, you know, I'm very, very reassured. It's great to know that I will have access to this levels of expertise if indeed required. But I also think it's important to point out, you know, this is in contrast with recent actions that we've seen outside schools, where you know, where I can only describe it as reckless actions, and similar actions recently were bullying pregnant people in Foyle Arena. You know, it must be very, very frustrating for those who are out at the coalface of this, doing a professional job, when they see the reckless, mindless incidents that this city has witnessed. So no question, just to put on record my appreciation of the great work that the staff are doing. Thank you.
Again, you, Gary. Back to yourself, Teresa and Bob, please.
Thank you very much, Chair. Chair, there's quite a lot there around our nursing staff, particularly from Alderman Carrigan. So I'll just work my way through and then I'll hand over to Bob for that. Just on the point that Alderman Guy made around GP surgeries and the potential that they might be contributing to pressures. I mean, all I can say, Alderman Guy, is that when these issues are raised with the trust by elected representatives, because they are when we meet them, that I have a process whereby through our comms links with the Health and Social Care Board through Oliver, that we pass back any particular issues or queries that are raised by our elected reps, and that's to make the Health and Social Care Board officials who are responsible for the oversight of those services aware of the concerns that are being raised. And Chair, other than that, all I can say is that obviously you're open as a council to call to have direct representation from the Health and Social Care Board who do manage our GP services. I don't think there's anything further on domiciliary care, Alderman Guy, and I can say you made a comment about staff who are double jabbed being back at work and staff who are not vaccinated not being back at work. I'm sorry, the lights have gone here. Beg your pardon. We have, and we're not the same in the health service, health and social care, as those working outside health and social care. So we have a process whereby anyone working in health and social care who is a close contact does have to self-isolate for 10 days unless they've had a PCR test at days 2 and 8, but also they have to be risk assessed for return even if they are negative. So there is an additional obligation on us and on our staff when a member of staff is or is not vaccinated. And so we pass a higher test, as it were, or we expect a higher test of staff who work in health and social care than outside those services. Alderman Corrigan, can I ask that you pass on the information about Rosebud Cottage and the respite issue to Oliver? And he will make sure that goes to our Director of Women and Children's Services, Deirdre Mahan, so that you can have direct communication with Deirdre on that. The rest of your questions really were around redeployment, safe staffing and incentives for our staff and PPE and breaks. And mostly I'm going to assume that those are around our nursing colleagues. So I'm going to hand over to Bob and just finally say to Councillor Donnelly, I'm very glad that you're able to tell us the story that you were tonight and place your appreciation on record. It is for the staff of Alton McElveen Hospital and all the people who support those services that have worked hard to make sure that the individual you talked about survived and hopefully recovers well. So Bob, I'll hand over to you.
Thank you, Teresa, and can I also thank Councillor Donnelly as the chief nurse. I'm very, very proud of every nurse and midwife, indeed all the multidisciplinary team for their huge efforts. And I just would want to say in response to Councillor or Alderman Kerrigan's questions, you did reference nursing, and you said you've been taking questions from several people, and they may work in more than one trust. So clearly I can only comment on what we do in the Western Trust. But you referred to when staff are redeployed to support other areas, are they properly trained and supported? And you referred to the pay uplift and also to working for long periods of time in personal protective equipment, and constantly being asked, can you come in and support? Those are all very important individual topics, but unless I, as the chief nurse, receive those individual concerns, I cannot respond, other than to say that for all of those areas we have very robust policy and processes in place, including training for the redeployment of nurses who support, for example, in ICU, and we are extremely grateful for their day-to-day work in an intensive care unit, particularly in this case group of theatre nurses, but not only theatre nurses. I was in intensive care in Altnagelvin for all of Tuesday and listened to and met the majority of the team who were working that day. With regard to any concerns, I would ask you to say to those individuals that we do have a raising concerns policy. Please encourage them to talk to their manager about any of those issues. So the band 5 to band 6 uplift is absolutely in place, and it should be one that is easily addressed. And if they have any concerns, please invite them to come to me directly. But I would like to finish by saying all of our team, nurses, doctors, physios, all the AHPs, pharmacists, those who have been mentioned today, carers, trust, hospital and community teams have been hugely professional. They've displayed their talents every day, and they've been loyal to the organisation, and they are very tired, and the resilience has been very tested, but we are extremely proud of them, all of our staff, and thank them for their huge commitment, and we will continue to do our best to support them in the days, weeks and months ahead. Thank you.
Thank you, folks. I have one further indicated speaker. If I could ask Alderman Hussey. Derek, please.
Thank you, Chair, and thank you, Teresa and Bob. And just like Gary, I'll relate a story with regard to the SWA, whereby a friend known to several of us went in there, and as a COVID survivor, thanks to the staff at SWA, I think he had to be revived at least 2 times when he was there. So, huge thanks to the SWA staff on that. And I suppose when we've moved away now from Altnagelvin to SWA, I'm going to move further along the line to the Omagh Enhanced Hospital. And could you briefly elaborate on what I see as the increasing importance within the trust system of treatment of the Omagh Enhanced Hospital site and its facilities? I've had cause to be there for x-rays, etc. And I heard my colleague, Councillor Guy, referring to queues for x-rays in Altnagelvin. And I mean, you can, Omagh is a walk-in for x-ray, and it's an absolutely fantastic facility with great staff. So I'm wondering about the increased importance, and is it being properly used by the Trust to deal with the current situation, not just COVID, but the backlog, etc. I know that there's some elective surgery, I think, is being delegated to the Omagh site. And I suppose with that, can we have an assurance that staffing will be there to properly facilitate the increased importance of the Omagh Enhanced Hospital site? And my second question would be with regard to mental health. And again, we're in the Omagh scenario. The promised enhancement via phase 2 of mental health facilities
Thank you, Derek. If I could come back to yourselves, just Teresa and Bob, in terms of Alderman Hussey, please.
So, Chair, in terms of Omagh Hospital, the inpatient beds in Omagh Hospital are Bob's responsibility, as they are there to support patients at end of life or palliative care and also rehabilitative care. I didn't quite catch, Councillor Hussey, the issue about staffing, but Bob may want to say something about that. But I would like to say something about the availability of unscheduled care services at Omagh. We do have a very good urgent care and treatment centre at Omagh, and we would encourage the population to utilise that well. It has a very swift turnaround for those health concerns that are perhaps less acute. And it's certainly, if our population were willing to use it more, I think they would find it a very, very good experience. In relation to your question about the backlog and elective care, I can confirm that we've certainly increased our use of Omagh Hospital, our day case unit and our diagnostics over the COVID period. Omagh Hospital is seen as a COVID light site because it does not have an ED and we do not stream in the same way. So we have, for our less complex surgery, been moving some of that surgery to Omagh Hospital. And maybe just add to that briefly, you will know that our Minister is keen to support the enhancement of elective care through COVID light sites, and has been very clear that Omagh might well be one of those sites. So there is work happening at a departmental level on this as part of the elective care plan. So we're very hopeful that Omagh's excellent facilities will be used for the region as well as for people in the Western Trust area. And before I come back to Bob, just on the mental health enhancement phase 2, I don't have any indication, Councillor Hussey, of when that development will be on the ground. The business case is still in the system with the Department of Health. Bob, anything further you want to add on Omagh?
To say, Councillor Hussey, a very stable workforce in the Omagh Enhanced Hospital and Primary Care complex, and that's both for the ward-based care that Teresa referred to, and the social care teams and the AHPs that are based there and working actively into the community there. So no particular concerns that I can respond to right now. Thank you.
Chair, if I can just make a brief comment, I'm disappointed that we're still waiting on that business case, which has been in the system for so long with regard to the mental health enhanced facilities at Omagh. That's nothing to Teresa and Bob, but it's so disappointing to hear that that business case is still in the system being examined, I suppose. Thank you, Chair.
Thank you, Derek. To yourself, Teresa, and to yourself, Bob, and to Oliver, could I, on behalf of the committee, and I know a number of, or all of them who have spoke, have given their appreciation and thanks, but on behalf of the committee, if I could give my appreciation and thanks for yourselves coming along today, but also for the wider work and the wider care that you provide day in, day out across city and district. So our thanks to yourselves, and we will obviously continue the conversation and the days ahead. Thank you.
Thank you, Chair, and thanks to the whole committee.
Thank you. Bye-bye.
Councillor Hargan, I know you were saying you had a proposal or a motion. I would suggest that it would be more appropriate if it went to full council. And full council's barely 2 weeks away and the deadline's tomorrow. Members, I'm conscious of the time. I'm going to suggest a 10-minute break if we could be back for 6:30. Thanking you. Okay, folks. Members, are we okay to resume again? Item 6, chairperson's business. Excuse me, there is none. Item 7, matters arising from our meeting open minutes from our meeting held on Thursday the 14th of October. For accuracy, pages 57 to 82. Poser and seconder, please. Councillor Tierney, Brian, thank you. Councillor Farrell, Rory, thank you. Poser and seconded. Matters arising, pages 57 to 82. Councillor Gallagher, Paul.
Thank you, Chair. It's HC 22821, and it's regarding reopening the council facilities. And thank you for letting us in. Just to raise an issue around opening it and the facilities in Melbourne Hall, and it's regarding the traffic management. There's some very serious issues with traffic and a serious build-up of traffic in the Melbourne facilities. And I know that the council staff on the ground are working very hard to try and resolve it, but there are serious issues with the safety of young children. And I have been talking to officers on it, and I was hoping that maybe we could get an update on how we take it forward. There's a lot of issues around the location, the geography of the site, and COVID hasn't helped, and the mitigation that we have to put in place for COVID. But there's possibly like an accident waiting to happen, and I would be grateful if we could get maybe an update around how we take this forward in the facilities in Melbourne. Thank you, Chair.
Thank you, Paul, and Council Officer Barry O'Hagan's going to respond.
Thanks, Chair, through yourself. Councillor Gallagher, I know we have discussed it briefly. A number of user groups have been on this, one user group in particular, around the traffic arrangements at night, particularly at the busy times. And some months ago, we did have our corporate health and safety team down who made some recommendations how we should manage at the site, which we have done. We have asked for a further meeting and an update with the corporate health and safety team. And look, we have had some recommendations from user groups, but members will appreciate that we take our guidance from the corporate health and safety team and implement based on those risk assessments. Members that are at that site on a busy evening will appreciate just the complexity of it and the road in and out of it, and have spoke to a number of members in the past around it. Look, the new Melbourne multi-sport hub, there will be proposals for additional parking, and additional parking at that site will be the only probably medium to long term solution. Not saying it's going to solve all of the issues. And just for members' information, the testing site is leaving at the end of this week, so that will alleviate some of the issues. I appreciate not all of them, but there will be additional car parking spaces. But we're managing at present based on corporate health and safety guidance, and we've asked for a further site meeting with those guys if we can make any changes. But we're not in the position to implement suggestions that the user groups are making to us because they're contrary to what our corporate health and safety team are saying. So, but if that changes, we will get the message out to our user groups going forward and how we're going to make those necessary changes. Thanks, sir.
I have two further speakers on this item. Alderman Hussey, Derek.
Thank you, Chair. Just a very quick one. Reference to reopening of facilities, changing rooms. I had cause to be at the Brandywell for a recent championship football match. I was approached afterwards. The changing rooms are open, but the showers are not available. And the teams were telling me that they do play in other council areas, obviously in that particular league, where changing rooms are open, but shower facilities are also available. So what's the situation with regard to showers at changing facilities? Thank you, sir.
Councillor Hussey, we held a briefing session following discussion with IFA, with the various league teams, and they undertook to communicate our position back to clubs. And at that stage, whilst you can shower in exceptional circumstances, the wording was around exercising that with discretion. So our shower facilities are available as part of our ongoing review of reopening. The priority is going to be for away teams. The leagues are content to take their lead from the governing body in that respect, and we will work, and I think we issued correspondence to the leagues that in any particular circumstances where there is a demand, where there perhaps maybe there's exceptional weather issues, for example, or whatever, our team will work with clubs to make sure that there is no basically inconvenience in regard to that. We are maintaining 1 metre social distancing, and the operational requirements around the team managing that process of changing, undertaking their risk assessment are requirements that the league have accepted and will correspond with clubs on. So Barry, do you want to add anything further?
Well, through yourself, Chair, Karen has covered all that. We have been working closely with the leagues, and the sports development team have had meetings in recent weeks with them, so we have no further feedback from the leagues. They're happy where we are, but as members will be aware, we're on a weekly basis monitoring the regulations, and we are opening up within our sport and leisure centres and pitches as the weeks go on, so we're keeping it open and under review. Alderman Hussey.
Chair, just a quick response to that. Perhaps the management of Brandywell would make away teams aware that, as Karen McFarland has said there, that showers are available, because that wasn't the case the last time I was there. Thank you, Chair.
Thank you, Derek. Councillor Boyle, Michaela.
Thank you, Chair, and concur with Councillor Gallagher, and I'm delighted to hear that there are a movement now on this in terms of facilitating, I suppose, the heavy duty vehicles, the amount of vehicles that are coming in and out of Melvin. I suppose Melvin is a victim of its own success, and delighted that all the groups now are be able back in use at Melvin. Obviously, all the user groups that are using Melvin to its capacity, and it's great to see. I would also urge parents who have a responsibility, obviously, for ensuring the safety of their children, that there are other areas in and around Melvin where they can park. I know, for example, the children's rugby that meet on a Saturday morning, they walk over the footbridge and park on that side of the town. I know, like, we do have the dark evenings, and I do appreciate every parent wants to ensure their children are safe getting to their activity and back, but there are some parking places in and around Melville within walking distance. So just to urge parents to be responsible in that regard, to use other car parks around the area of Melvin and in the Ballycoman and across the bridge also. I just want to, and I know you did mention the fact that the testing centre will now have to vacate Melvin, to facilitate the full reopening. And the testing centre have been doing a fantastic job at Melvin to facilitate the testing of people with symptoms of COVID. But just to give reassurance to people in the Strabane area, I would be aware you are probably looking at other alternative sites to relocate the testing centre to. Just if that's the case, to just to reassure people that the testing centre will not be leaving Strabane, albeit it may be leaving Melvin. If you could just maybe give us a wee bit of assurance on that. Thank you.
Yourself, Chair. Yeah. Serco had contacted us directly, Councillor Boyle, to state they were leaving and they're moving to another site that will meet the needs and demands at the minute. The numbers have dropped considerably of coming in, so
they're going to another site. I'm not sure if Karen is aware, but they are moving to another site, so I don't have the information at hand, but they are moving after Sunday evening.
Chair, I was just going to ask Seamus maybe to give some clarification on that, if he could, because you've been dealing with that aspect.
Through you, Chair. I'm just looking at my emails here. There has been correspondence this afternoon, and I understand Serco are liaison council officers in relation to potentially locating a testing site in, bear with me a second, Canal Basin Car Park. So that's the most recent update we have.
Folks, I'm just conscious of Alderman Hussey has put in register of interest. My apologies, Derek. I'm not fully sure of probably the shorthand. No.
Sorry, Chair. It's the payment licenses, and through my own business premises, I have a payment license, but that's already in my register of interest, so it's just clarification on that. Thank you, Chair.
Appreciate that, Derek. Thanking you. Folks, is there any other items arising from the minutes of the meeting of the 14th?
Yeah, Chair. Chair, thank you. HC 241/21, at the bottom or at the top of page 80, the Director of Health and Community stated that she was happy to consider this suggestion. I'm wondering, has she considered it? And if so, what is the position now at the moment? Thank you.
I've passed that to my team, Councillor Taney. I don't think we have a conclusion on it, but we will report back to you quite shortly. Thank you.
Chair, on 236.
Okay, Derek, thank you.
Thank you. Just to congratulate the Good Relations team, we already have a presentation with regard to Srebrenica. I think it's on the 17th of November, and having been out in Bosnia myself, can I recommend that to all members, not just members of this committee? If they check online, I think it's Peter Osborne is giving a seminar on the Srebrenica and Bosnian situation vis-a-vis our situation in Northern Ireland, and I can highly recommend it. But thank the Good Relations team for acting so quickly on that. Thank you, Chair.
Thank you, Derek. Okay, members, unless anybody else makes me aware, I'm going to move on from item 7 to item 8 and ask Seamus to take that, please.
Thank you, Chair. The purpose of the report is to update members on the Northern Ireland Food Strategy consultation, which was recently published by the Department of Agriculture, Environment and Rural Affairs. The consultation outlines the strong links between food, health and environment, and how food cuts across a number of government departments. The food strategy framework will be a dedicated programme within the Executive's Green Growth Strategy and the Climate Action Plan, and sits alongside the Agriculture Strategy. The draft consultation response to the proposals is enclosed in committee pack, and subject to outcome, it's anticipated the agreed framework will be published early 2022. The strategic framework will help address challenges to improve the environment, health and food poverty, and contribute to the programme for government draft outcomes framework. The members, we are seeking your approval of the draft response prior to submission to DAERA by the 19th of November.
Thank you, Seamus. Councillor Duffy, Sandra.
Chair, in the absence of anyone else content with the consultation response from Council, so happy to propose those not needed.
And I'll second it, Alderman Devaney.
Thank you, Chair, and thank you, Seamus. Well, People Before Profit doesn't support this food strategy document. It doesn't do anything to address the harm done by the Going for Growth strategy, which incentivised intensive industrial agriculture driven for export. And one example is the huge pig farm that people campaigned against in Limavady. A farm that had 90,000 pigs in one building, their feed coming from Brazil, and then the pigs being exported to China. And it's this kind of agricultural model that is a disaster and makes no sense and adds to the climate crisis. Agribusiness corporations who are profiting from this leave behind their biggest costs off their books. The costs fall on the environment, animals, farmers, workers, and consumers, and public health agencies. And so this draft document does nothing to curtail corporations who exert a lot of control over production, distribution, and trade policy. So we just want to get on record that we believe that Stormont should be looking at alternative models to develop different ways of producing food that aren't based as they are right now on industrial agriculture and that is profit driven. Unfortunately, there's actually very little specifics in this document. It's an attempt to make it look like there is a change of direction following going for growth. But it really just says that we're doing all the inputs and we're taking, but there's no actual change. So we just want to get it on record that we're not going to be backing the food strategy document. Thank you.
Thank you, Sean. Folks, I don't see any other indicated speakers, and I know it was proposed by Councillor Duffy. Sorry, I didn't catch the name of the seconder.
Morris here, Alderman Devaney.
Seconded. Folks, if there's nobody else looking to speak to it, I'll ask Karen to take a vote on it, because obviously there's been opposition expressed.
Okay, members, Alderman Devaney.
For.
Alderman Guy.
Abstain.
Alderman Kerrigan. Alderman Kerrigan. Councillor Sonoya Barr. Is that 4? Yes. No.
Yes, Paul.
Thank you. Councillor Boyle. Councillor Carr. Sorry, not present. Councillor Duffy. Or Councillor Edwards.
For, Karen.
Councillor Farrell.
For.
Councillor Ferguson.
For, Karen.
Councillor Fleming.
For, Karen.
Councillor Harkin.
Against.
Councillor McGinley.
For, Karen.
And Councillor Cheney.
For.
Okay, members 10-4, 1 abstention and 1 against.
Thanking you, excuse me, thanking you, Karen. If I could move on to item 9, and again, ask Seamus, please.
Thank you, Chair. The purpose of the report is to update members on the changes to the criteria for the affordable warmth scheme and seek approval to sign the interim SLA with DFC. Members will be aware of the affordable warmth scheme which Council has delivered in conjunction with the Housing Executive on behalf of DFC since 2014. And it covers a range of measures to improve energy efficiency in homes. Changes to eligibility criteria, including the income threshold, came into effect in July, and council officers are making contact with applicants who wish to be reconsidered as a result of these changes. The scheme remains a targeted scheme, and council continues to submit approximately 30 referrals each month. Members, of the report also outlines other fuel poverty assistance schemes which may be available to those householders which are not eligible to avail of the affordable warmth scheme. And members, a further update will be presented to this committee when the DFC review the current fund model. So members recommend that the service level agreement with DFC is approved.
Thanking you, Seamus. Councillor Boyle. Michaela.
Thank you, Chair, and thank you, Seamus. That was just to make the comment. Obviously, we all welcomed these changes to the criteria in terms of the income threshold from 20,000 to 23,000. Just in 3.6, Seamus, and you did allude to it, that councillor are doing a phased, targeted approach to those who would not have been eligible or didn't want to, and get involved in the full uptake of the affordable warmth scheme, and you are contacting those applicants. Is there have you a figure, or in terms of those applicants who probably weren't successful, and are now, if council are contacting them, are they many with that, going forward with the uptake on the offer now of re-entering into the scheme again?
Through you, Chair, Councillor Boyle, it's those applicants that fall between the 20 and 23,000. My understanding is a small number. I don't have the figures with me today, but I'll get them provided to you at a later date.
Councillor Farrell, Rory.
Thanks, Chair, and thanks, Seamus, for the report. Affordable and warmth aren't two words that we're used to hearing together, particularly of late. It's a bit of a misnomer, in fairness. Yet again, today, we've heard of a further fuel gas price rise of 38%, and that's the third this year. Rising energy costs, rising costs of living, the cruel and callous cut to universal credit have put many families and many individuals in a really precarious position as we enter winter. The executive needs to act. My party colleague Matthew O'Toole, the MLA for South Belfast, said today that the executive needs to convene a task force immediately, including the finance minister, the economy minister, the communities minister, to produce a suite of actions to help the most vulnerable in our society get through this winter. There's an opportunity around, there's a £21 million contingency fund for the Spend Local scheme that could be directed to help people that are suffering, that are experiencing fuel poverty because of these price rises. So I want to make a proposal that we write to the executive, asking them to urgently convene a task force, including those ministers that I stated, to see what can be done to support and protect the most vulnerable in society from these rising fuel costs. So I'll send that through to Nuala now. But on the actual item, Seamus, it's positive news that the Minister has introduced the long overdue changes to the scheme that makes it more accessible for people. The income threshold has been increased and certain benefits have been disregarded. But I've got 3 questions about the scheme. So our target is 30 referrals a month. Do we think that's achievable in the long term? We've got the 80-20 split in terms of 80% from the targeted scheme, 20% from the non-targeted. Are we on track to deliver that? And do we have a bank of non-targeted referrals that we can just use whenever? And there are certain aspects to the affordable warmth scheme, insulation measures, boiler replacement, etc., and windows. And previously, the focus within DFC was that it was targeted towards heating systems, and windows weren't really a priority. So my question is, has that changed? Are we allowed to have window schemes through the affordable warmth? Thank you.
Through you, Chair, the scheme has, as I said, outlined earlier, since 2014. There's been a very high demand for the service. Unlike some other councils, we have no difficulty meeting that target of 30 per month. And if we were allowed by DFC to increase that, we would. In terms of the scheme itself, it is a targeted scheme and it does prioritise various energy efficiency measures. it's probably fair to say that one of those are probably further down the priority list. But by all means, my understanding that they still are part of that list, depending on what the defects are within the property.
Councillor Gallagher, Paul.
Thank you, Chair, for letting us in, and thank you for the report. And I, like others, I welcome this report and the rise in the threshold. We've been implementing this project for quite a while, and you could see the difficulties that people had by just going over the threshold, particularly the most vulnerable in our community, because the calculation of DLA and PIP was added to the threshold, but I'm glad to see that that is removed. I just have maybe something to raise with council officers, and we've seen in recent times all the stuff around the climate change and the impact that we can have on that, and housing and affordable warmth is a great way of reducing the situation we find ourselves in. And this scheme is a great scheme. But one of the things that particularly that's happened over COVID is there's been a severe rise in the cost of building materials. And that is having a real impact on what customers can avail in this scheme, because Housing Executive had set a limit per house, and because of the impact of this cost, then that is really and greatly reducing the impact that we can make on each individual homes. So I think that the allocation that they have per household needs to rise in line with the severe cost of building materials. So I think that to make maximum impact within the council district, that needs to change. Thank you, Chair.
Thank you, Paul. Alderman Devaney, Morris.
Thank you, Chair. And just on the report, we would welcome the report. It's good to see that there has been some changes to the threshold, and it's good to hear that we're going back through those who would meet that threshold now that we're going back reviewing them. And I think it's vitally important. And as the previous one of the speakers has said, affordable warmth at the minute. It's hard to know where it's affordable when we look at the huge energy crisis that have been hiked in this last number of months. And that is, Chair, and despite all our renewable schemes, you know, the windmills, the solar panels, the biodigesters, that we're going to have cheaper electricity, and we see what's happening today in the market. But Chair, for the recommendation, if it hasn't been proposed, Chair, I would propose the recommendation, and if it has been proposed, I would second it. On the proposal here, in front of us here, I have no problem in seconding that proposal. I think it's a vitally important time that we write to the executive and do what the proposal says here, because you know this is severely impacting on the most vulnerable in society. And as Councillor Gallagher said, the cost of everything is going up, the cost of living is going up, and you know we talk about the vulnerable out there, you know, not able to afford it as a toss of the dice between heat or eat. And you know, Chair, when we look at even that those that are being employed at the minute, a lot of them are falling into that category as well. You know, we now have the working poor that are finding it financially difficult, paying mortgages and HP and cars and the utility bills and stuff like that. But Chair, we have no problem in seconding and supporting the proposal here.
Thank you, Morris. And I have a number of further speakers in this, but Councillor Farrell, in the thing of consistency and fairness, I would ask you to bring this proposal to full council.
Thanks, Chair. I was really only signaling the second the proposal, but No, you're grand. On response, Seamus's responses led a question, and in my mind, and I think Seamus was sort of hinting, in his response that if we were allowed, we could exceed the 30 per month that we are allowed. And I think you also sort of hinted, and I hope I'm not picking you up wrong, that other councils aren't fulfilling their 30 per month. And is there anything that we can do or should be doing to see if we can maybe pick up that surplus? Because if the DSC have the funding there, say for argument's sake for 60, and it's 45 from Derry and Strabane and maybe 15 from Causeway Coastal Plains, it's still 60, and the budget is still there within DSC. Is there any way that we can contact and write to DSC to see if we can pick up the surplus from neighbouring councils?
Through you, Chair, in terms of it is a targeted scheme, and there's always been a lot of discussion in relation to the 80% targeted, 20% non-targeted. And this committee had set up a member-led task and finish working group and met with representatives from DFC and the Housing Executive. There's always been a variance in demand across the region, and that remains the case. I would recommend members that when the DFC review the funding model, which hopefully will address some of the issues raised from Councillor Gallagher and Alderman Devaney about the cost of energy and the increased cost maybe to deliver some of these schemes, that perhaps members can review the outcome of that review and then feed back to DFC.
Councillor Harkin, Sean.
Thank you, Chair, and thank you, Seamus, for the report. And look, just on the report itself, having been part of the discussions where we collectively as a working group met with the DFC and the Housing Executive and try to figure out how we as a council could squeeze as much as we could out of what is a restricted scheme. I think that we are responsible for some of the better proposals that are in this, including the increase of the threshold, which means more people can access it. Our council makes more use of this than many other councils and has been fighting to get access to more, because we can make use of more, which isn't just about houses, it's about them having people from the council that can actually do the follow-up work. Seamus and others have played a key role in actually figuring out how to do that and making the case for our council. So some of that stuff's in there, and I think that that's the work of our council officers and the collective efforts of the working group. I'd also say, though, it is a very restricted scheme, and that's not the fault of this council or our efforts in terms of trying to get as much out of it for our residents. But in the context now of everything we're discussing, from climate change and energy efficiency, we are going to need a completely different approach from the executive that this particular scheme won't be fit for purpose for. So that's really just I think we made good contributions to strengthen this, but we're going to need a massive overhaul and a new way of doing things if we want to energy proof and climate proof our existing houses and our buildings and any new builds that are coming forward. So I think that that's the positive thing. On what Councillor Farrell raised, I think that these things are dominating the headlines. The domiciliary care is just as big of a crisis as the energy crisis that people are facing across our district. I think that there needs to be an emergency meeting of Stormont where they look at all the possible ways in which we can protect people from expanding the winter fuel scheme to looking at what can be done with the VAT that's going to be coming in as a result of the increased prices. That'll be an increase in VAT as well that's going to government. What can we do with the actual companies that are, it's unclear how great their profits will be from the greater costs that people will be burdened with. And this is not something that's just hitting vulnerable people. That's the thing about this. We know that 30% of people here in our district live in poverty, but the people who are going to be impacted by Firmus's increase and the other all the other energy price increases, it's going to go way beyond vulnerable people. And that's why I think this has to be a priority in Stormont. I mean, really, we need a full session dedicated to this to talk about what we can do through our own council. We have a hardship fund, we have an anti-poverty task force. So I think the first thing is we all collectively should be demanding Stormont. I don't understand either why any of the ministers or any of the parties who are part of the executive weren't prepared to be out publicly ahead of everyone saying this is our strategy for dealing with this, when we were told by the energy companies that they were going to double the prices again by the end of the year. So it seems like there was no plan put in place. Now there's a scramble. So that's a lack of leadership, I would say, coming from the executive. So I think we have to put the onus back on the executive to meet immediately, to begin to put forward, to begin to enact some of the solutions that many people are proposing, from trade union groups to the National Energy Action Group, the Consumer Council, the Old People's Commissioner. There's lots of proposals for action, and these things should have been in place, knowing that the doubling of energy, doubling of gas prices was imminent. Thank you, Chair.
Alderman Wolsey, Derek.
Thank you for allowing me in, Chair. As I was to totally agree with what has already been said. Most of what I wanted to contribute is already there. To agree with Councillor Turney with regard to seeking perhaps access to those areas where there's a lesser uptake. That makes sense, and the department should seriously be looking at that. Thanking Seamus for the report. One item within the report and within the overall scheme, I suppose, is the boiler replacement scheme. And I wonder, and it's been mentioned there by Councillor Harkin, you know, climate change. Is there any stipulation in that as to the heating, rather than a boiler replacement, I would refer to heating systems. We think about heat exchange, we think about, you know, thermal energy and all of that sort of stuff. So is there any indication that the boiler replacement scheme, so-called, would actually be moving towards a heating system, a climate change friendly heating system scheme, rather than just replacing an oil boiler with a new oil boiler? Thank you, Chair.
Through you, Chair, I think there's 4 priority areas within the scheme. The first one would be installation and providing hot water cylinder jackets and cavity wall installation. And the second priority is replacing solid fuel with LPG for Economy 7. And as referred to earlier, the priority 3, I think, is windows. But there is a list of support mechanisms out there. We're happy enough we'll circulate them to members just for information, so that they can pass on the information on to their constituents. In terms of the further detail, I would need to look into that further and come back to you on it.
Thank you, Seamus. Thank you, Chair.
Thank you, Alderman Guy. Darren.
Thank you, Chair, for letting me in. Look, whilst I welcome the change to the threshold from the 20 to the 23, am I right in saying that for a single person it has actually dropped to 18? So if that's the case, they're given one hand, taken away in the other. Also question, is the scheme being run to its full potential? And are the right people benefiting from it? I know that we have the 80-20 makeup of it, but I feel that the 20% outside the targeted seems to always be more in need, not maybe more in need, but there seems to be a lot more numbers, or rising numbers there. Look, I met with the chairman of the National Insulation Association of Ireland, and I got a real eye-opener to how this is all working. Things like, out of 370 houses, they reckon only 9 were surveyed properly. There's a machine, I can't recall the name of it, but it does thermal checks. And he believes that unless we return to the part 1 of this, where it's insulation is the main thing, there's no point in having your house, if it's not insulated properly, putting on windows, putting in a new heating system, because it'll all escape. So unless the thermal checks are carried out properly, then you're really just burning the money that you're putting into it. And Councillor Gallagher spoke about increases. He reckons there was a 50% increase in products, and as well as that, even problems obtaining them because of the protocol as well. Now, he also spoke about cavity wall insulation extraction, which the housing executive do, and to be honest, the numbers are quite low for the amount of funding that they're getting to carry out these things. And just one more thing, an internal audit report was apparently carried out in March 21 by the department, and I don't think it's ever been released. Maybe Seamus might know more about that than I do, but apparently it was quite damning on the whole scheme. Thanks, Chair.
Thank you, Darren. Councillor Duffy. Sandra.
Thank you, Chair, for allowing me in. And I was actually coming in to respond to Councillor Farrell's proposal. I have to agree with him in terms of the spiralling costs of energy at the minute, and we do need to be looking at all options that are open to us. I will await a motion coming to full council, but in terms of the finance minister today, he has also called on the British government to scrap the VAT on household energy costs, something that I hope Councillor Harkin can get on board with as well. I think that there is a lot of work to be done. There is worrying times ahead in terms of the costs of living, in terms of all household costs, not just energy, that we need to be looking at. But I suppose just in terms of the report, I do really welcome it and welcome the work of Minister Hargey in terms of addressing some of these issues and widening the criteria for the affordable warmth. And I know that it is her ambition to do what she can to protect the vulnerable while she's in office. So thank you, Chair.
Thank you, Councillor Duffy. Appreciate that. All right, folks, and obviously there's a wider aspect to this which we will address at full council in relation to the report, and it's proposed by Alderman Devaney. Seconded by Councillor Farrell. All right, everybody okay with that? Thanking you, folks.
Thanks, Chair. Members, the purpose of the report is to seek nominations to the Impact of Policing and Community Survey Task and Finish Working Group. Members, you'll be aware of the October committee meeting and the proposal around this. So in line with the agreed composition of working groups, one nomination is requested from each of the parties and one nomination from the independent members of council. It's envisaged the first meeting of this group will be given, consideration will be given to agreeing the terms of reference, the name of the group, identification of key issues, outputs, outcomes and timeline for completion of the work. So in terms of recommendations, members that each political party nominates one member and one member is nominated from the independent sector within council to participate in the task and finish working group.
I have Councillor Tierney, Brian, but just to say as well on the group chat, there's been a nomination for Alderman Kerrigan on behalf of the DUP. Councillor Tierney, Brian.
Thank you, Chair. Thanks to Barry and the officers for the work around this report, not only from getting it from October to now, but obviously it was first muted in September, where this conversation began. But on behalf of the SDLP, to nominate Councillor Lillian C. Bar. Thank you.
Thank you, Brian. Councillor Duffy.
Yeah, likewise. Thank you, Barry, for the report. And just on behalf of Sinn Féin, nominate Christopher Jackson.
And you, Sandra, and I see on the group chat on behalf of the Alliance, Councillor Ferguson has nominated herself. Thank you, Rachel. Okay, folks, if there's any other parties or anybody else that want to nominate at full council. Moving on to item 11. On to item 11 and asking Barry again, please.
Thanks, Chair. Members, the purpose of this report is to seek confirmation on the approach to an invitation to give evidence to the Northern Ireland Affairs Committee. Ahead of the results of the 2021 census, the Northern Ireland Affairs Committee is holding an inquiry into the experience of minority ethnic and migrant people in Northern Ireland. At the last census, minority ethnic groups comprised 1.8% of the Northern Ireland population, while people born in countries that joined the EU from 2004 accounted for a further 2% of residents. The inquiry opened in April 2021 and is currently hearing evidence from a large range of stakeholders, including representatives and stakeholder groups, charities and companies with a significant minority ethnic and/or migrant workforce to submit evidence to the inquiry. Both Belfast City and Mid-Ulster councils have also been approached to give evidence. And members, this inquiry covers all of Northern Ireland and is currently hearing evidence from a range of stakeholders. There are two options for members to consider. Option 1, a delegation gives oral evidence to the inquiry. Members should confirm the membership of such a delegation. And option 2, a written response be provided to the inquiry on behalf of council. And members, just for information, Wednesday the 1st of December at 2:30 p.m. is the date for option 1, and participation can be via Zoom. So in terms of recommendations, that members consider the two options presented to them and indicate the preferred option on how to proceed. Thanks, Chair.
Thank you, Barry. Councillor Shinoy Barr, Lillian, please.
Thank you, Chair. I have to declare an interest here as the only person from a minoritized background in the chamber. Chair, I would like to put on record my thanks to the Northern Ireland Affairs Committee. I have to commend the committee for taking a greater interest in issues relating to minority ethnic people across the North. I think this is the first time ever in the history of this country that the Northern Ireland Parliamentary Committee has shown an interest in issues that impact on people beyond the usual orange and green politics. And I must pay tribute to the SDLP MP, Claire Hanna, and Alliance MP, Stephen Furry, who made representation on our behalf to influence the decision to call for evidence of experiences of minoritized people in the north of Ireland. Claire Hanna and Stephen Furry are both members of the Northern Ireland Affairs Committee. I'm very pleased that the Parliamentary Committee has not just focused on our experiences, but is also seeking for evidence from statutory organization and local council. I was very lucky to be one of the people who provided evidence on behalf of the Northwest Migrants Forum recently. And we also made a written presentation. We made a submission as an organization. This is a significant step in ensuring that the voices of minority ethnic communities are included and also discussed as part of the Northern Ireland Affairs. And it is a clear indication that we are moving beyond those orange and green issues. So a few years ago, this council established a strategic forum which under the Good Relations Department that linked in with Derry City Strabane District Council. It's, however, disappointing to learn that council no longer have a formal relationship or formal involvement with that forum. While the council has been hosting cultural events such as the Ubuntu Festival, as well as supporting the Syrian Refugees Resettlement Scheme and providing small funding through the grant aid to organizations such as Women's Center, it is vital that we do our part to fully implement the racial equality strategy in all areas, including and especially the integration of all minority ethnic people at all levels of society. And that is recognizing the specific barriers and hurdles that they face. So minority ethnic people are impacted by all policies made in the North of Ireland, yet are usually only consulted about our unique experiences when the issues is about hate crime or racism, or even when council wants to highlight our contribution to the cultural aspect of the council area. And that is always through festivals and arts. But we know that minority ethnic people are more than dancers. They are more than music or spicy foods that everybody like. They are more than the rich cultures that you see, and we work in all aspects of society. They are in medicine, they are in health, they're in business, they're in education, they retain manufacturing and technology. So I have many friends living in the city and district who are software developers at Seagate Technology. Today, we've had a good presentation from the healthcare. We do know that in this chamber, so many of you would have come across consultants and nurses in the hospital and have met maybe their families also here. So you know that the contribution is beyond what we normally see or hear from this community. So we can't really reduce minority ethnic people on good relation issues. And every policy that is made in this council area impact on every single person in this council area, regardless of their backgrounds. So, and even more so, people of minority ethnic communities, because they have other barriers that they face well before they can access any service. And this is why I'm delighted that the Parliamentary Affairs Committee is seeking evidence from this council area, particularly on how council ensures minority ethnic and migrant communities and their voices are considered and involved in decisions and policy making, how council collects data on ethnic minorities to inform its service provision. So members, you would recall that I recently tabled a motion on ethnic monitoring, which passed unanimously. This motion highlighted the lack of ethnic monitoring, not only in this council, but across Northern Ireland. And I also welcome the fact that the Parliamentary Committee is seeking evidence on how council will ensure that minoritized communities are represented in local government. I alluded earlier that there used to be a forum which was meant to be a strategic forum for minority ethnic people in the council area, but now I have confirmation that from the chair of the forum and also a good relation officer that council no longer have a formal relationship with them. That is not only disappointing, it's also letting us down as a council. And on integration, particularly for Syrian refugees, I am not sure how much councillors would know about the refugee settlement scheme, how many Syrian families have been settled in Derry or even in the Strabane council area as a whole, how many families still live here, and how many of these families are active in the job market or even within the community beyond the cultural traditions. And in terms of the form of evidence that we should take, our preference will be option one. I would also like to encourage every elected representative here to inform themselves of the many racial inequalities that minority ethnic people are experiencing here and what this council has done to identify those inequalities, what has been done within council to either address those inequalities or to make representation for those inequalities to be addressed. Thank you, Chair.
You, Lillian. Councillor Boyle, Michaela.
Yeah, thank you, and thanks to Lillian for that. I also welcome the fact that the Affairs Committee are looking to this council area to seek views from ethnic minority groups and representatives of those stakeholder groups and charities. I do know there's two options there, but I would like council maybe to, we have a very successful ethnic minority group in Strabane also, just to ensure that they're included and that they get the opportunity also. SECA and Strabane, the Strabane Ethnic Community Association. So it's just to allow them also to avail of this opportunity and to be made aware that this is an opportunity for them to have their say at this time at the Affairs Committee. So if that could be action, maybe to write to SECA and to make them aware of it if they want to take that offer up. Thank you.
Michaela. Councillor Tierney, Brian.
Chair, thank you. Councillor Sinoy Barr has, as I understand, proposed option 1, and I'm happy to second it.
Okay, folks, option 1, the report proposed option 1 and seconded. Everybody okay? Thank you, folks. Moving on to item 12.
Sorry. Well, just also with option 1, it is saying members should confirm membership of the delegation as well. So if members have a view on should it be an open invitation to members or should parties or whatever it might be. So if members had a view on who would be attending this meeting, either in person or via Zoom.
Tierney, Brian.
Chair, thank you. In relation to the membership of the delegation, have we any idea what the options are? You know, is it an open door policy? Is it one from each party and an independent? Or what way is it? Is it officers? Is it outside people like the organisation that Michaela has touched on and Lillian has touched on, Councillor Barr has touched on as well? What way is it? Is the delegation being made up?
Through yourself, Chair, they haven't been entirely specific, but they're asking council as an organisation for participation in this. So it would my understanding that it would be elected reps and or officers that would represent the council and provide feedback into this inquiry.
Councillor Donnelly, Gary.
But Chair, thanks for letting me in. Just a couple of wee comments. You know, when we talk about Syrian refugees and resettlement, I had chance to be speaking to some people there within the last 2 months, and it seems to me that some of these people have just been abandoned. Some of them didn't have access to the benefits, and some of them didn't even have access to equipment, medical equipment that they needed for some disabilities they had. But just when again, I'm not a member of this committee, so can't make a proposal, but it would be somewhat ironic if the councillors here took a decision that they would choose one from each party and one independent, when in fact, you know, we would be excluding minorities in order to talk about dealing with ethnic minorities. So I would like councillors and aldermen to bear that in mind when making a decision or making at least a proposal. Cormac.
Thank you, Gary. Councillor Sinoy Barr, Lillian.
Thank you, Chair, for bringing me back again. I actually agree with Councillor Donnelly there in terms of Syrian refugees being abandoned and just left when there are organizations that are accessing a lot of funding to resettle them in the city. But I think that is a discussion we can have later after this because it is important for the organization to be given the opportunity to maybe present what they have been doing to support those Syrian refugees who are coming here. In terms of the evidence, we have just been informed that this call was made in April this year, a lot of people from minority ethnic communities have already submitted evidence, and the committee is also accepting evidence from minority ethnic people, although the deadline has passed. They are not leaving anybody out. Where we have actually organized extra, through the Northwest Migrants Forum, extra focus group discussion to facilitate that work for others who felt that they were left out. So we will be, I will be more than happy to support the Strabane group to submit their own evidence, or they can just go ahead and get information from the website and submit. It's still being accepted. In terms of council as an organization, I think it is important that elected representatives are given the opportunity to provide evidence directly on, and it is also a good opportunity to educate yourselves on these matters. And maybe what council could do is support councillors through the organizations that are already being funded through council to access those groups to inform themselves before December. Thank you.
Thank you, Lillian. Councillor Harkin, Sean.
Yeah, as to the question of who, we would be happy to participate in giving oral evidence ourselves as part of a broader team of representatives from the council. And I would be willing, I would argue it should be as broad as necessary so that nobody's excluded. I don't think I think we'd be happy with one representative being on this body as People Before Profit. That may be true of other parties, and I don't see a problem with if each of the independents wanted to be represented as well. The key thing is that I think we want to make as powerful a representation as possible, speaking up for our minority ethnic community here in our district, and also speaking to their experience based on what we have learned over the last number of years, and also then backing up what councillors like Lillian, if she happens to be part of that delegation, but also supporting the other organisations that are giving evidence to the body.
Thank you, Sean.
So, Chair, maybe to facilitate the discussion, if we assess interest from council members, we compile those who have come back to us. It's a 45-minute session, so that will obviously curtail input. And we have a discussion as to how we do that, whether we have nominated speakers or whether there are equal speaking rights for everybody. And we'll have some discussion with the inquiry panel as to how they think it's been best facilitated if they've obviously been hearing from other groups, if that's helpful.
Thank you, Karen. Councillor Duffy and then Alderman Guy. Councillor Duffy.
Thank you, Chair. And Karen, that's just probably hit the nail on the head there. We don't need to go on to we can assess that. And I would agree with Councillor Harkin, if there is a broad representative group from the council who have an interest in going and providing evidence, then nobody should be excluded from it. So I would be in agreement with Karen's proposal.
Thank you, Alderman Guy. Darren.
Yeah, just saying, we'd be happy enough too with someone from each party and each of the independents as well. We have no problem with that there.
Thank you, Darren. Councillor Tierney. Brian.
Chair, thank you. We'd be happy to see who wants to go, and whoever wants to go should be invited and included. But just to be very clear, whenever I asked, was it one from the political parties and one independent, that wasn't to exclude anybody or to leave anybody out. It was the practical matter of having to make a proposal here this evening. That we have to propose all of our group, half of our group, or one of our group. That was the reason. It was never about trying to exclude or leave anyone out, Chair. Thank you.
Okay. We have maybe happy is not the right word. Are we content to move forward on that business, folks, and come back there at full council if need be? Is that okay? Okay, thank you.
Thanks, Chair. Members, the purpose of this report is to update you on the Move More Dairy Strabane initiative and the development of a wider cancer support programme. Members, you'll be aware of our Move More Dairy Strabane. It's a physical activity service for people affected by cancer. Move More Dairy Strabane has supported the employment and deployment of a full-time coordinator who leads in the management and coordination of the service and has provided support and guidance for people who have been undergoing treatment for cancer over the last 3 years. Due to the long hospital waiting times, delayed treatment as a result of the pandemic, officers now wish to expand the programme to cater for people prior to the cancer treatment in an attempt to get patients in the best possible physical and mental condition to successfully undergo treatment. The new cancer support programme will align with Council's other health and wellbeing initiatives, such as our GP physical activity referral scheme, and provide support and assistance from the point of diagnosis. Council have secured match funding totaling £45,000 to help deliver the programme for a further 2-year period. Members, there are no financial implications at present, as the request can be catered for through income generation and existing budgets. So, in terms of recommendation, that members note the current position and approve the development of a wider cancer support programme over the next 2 years. Thanks, Chair.
Thank you, Barry, for that. Councillor Tierney, Brian.
Chair, thank you, and thanks to Barry for the report, and I suppose thanks to those who are currently involved with the programme for their ongoing work. During my time as mayor last year, I attended a number of the events that they were involved in, coffee mornings and quizzes and one thing and another. And the service users, despite what they were going through personally within their own lives and obviously within their own condition, they were always happy and upbeat and cheerful and enjoying the fun of the activities that were there for them. I think as a council, we should be supporting this programme. We should be trying to make sure that we can develop a wider cancer support programme than the one that we already have, and absolutely give my support and our party support to it. And I would also just like to acknowledge the fact that the council have secured match funding for it to help deliver the programme for a further 2 years, because from what I have seen with my own eyes, it definitely is beneficial to those who use it in a very, very difficult time and very difficult stage of their own life. So thank you, and well done to those who are involved in the programme to date. Thank you.
Brian, Councillor Boyle, Michaela.
Yeah, thank you, Chair. And just to comment, this is very welcome, the Move More Dairy Strabane. I am aware of some individuals who have had support through this organisation. And as I alluded to earlier in my comments to the Trust in regards to individuals seeking transport for their cancer care treatment, this is, and as I mentioned, people with mobility issues and gait issues, that this is, who are waiting to undergo treatment. This is a very worthwhile programme for them to be involved in, and just to welcome it, and I'm glad to see that it has been extended once again. So thanks to everybody that's involved also within the programme. Thank you.
So Michaela, Councillor Farrell, Rory.
Thanks, Chair, and thanks, Barry, for the report. And I'd like to echo the sentiments of Councillor Tierney and Councillor Boyle. This council is one of the most impacted councils in terms of cancer across the north. We've got the second highest rate of cancer deaths. We've got the second highest rate of lung cancer deaths. We've got the second highest incident rate of cancer throughout the north. And we're in the Guildhall here, which is in the Moor, which is one of 80 DEAs across the north. And the Moor has the second highest incident rate of cancer. So cancer's a massive issue across our council area. And I would imagine that there's nobody in this chamber, or nobody that's online that hasn't been impacted by cancer. I know my father died from it. So I think it is right, and I think it is proper. The council provides this financial support to provide support for people that are dealing with cancer. So happy to support the item, and well done to everybody involved. Thank you.
Thank you, Rory. Folks, I don't have any further speakers on this, and I will say that all of the speakers who spoke very articulately in support of it. I don't know if there was actually a formal proposal. Councillor Tierney, Brian, Councillor Farrell, Rory, who's and seconded? Members, thank you. Item 13, if I could ask Karen, please.
Chair and members, the report is presented this evening, and I must acknowledge the input of the Community Strategic Business Manager and her work alongside developing healthy communities and putting together the input for discussion this evening. We seek approval for the delivery of a programme of activity to support the City and District's designation to the WHO Healthy Cities Network phasing. And to approve the costs in partnership with the Public Health Agency to support that programme. I think the background of developing healthy cities and the WHO designation was substantively covered in a previous presentation to Council, so you're very well aware of the background of that. I suppose very specifically there are a number of priority actions outlined at 2.5 that have been highlighted for your attention, where we feel that there is specific added value and working collaboratively, particularly around the whole entire aspect of health inequality. So in order for the Healthy Cities designation, there needs to be a full-time commitment to the coordinator, who currently is the Chief Executive of developing Healthy Cities, is nominated in that particular role. And there's a willingness and a keenness to look at the interrelationship and alignment of this piece of work alongside the Strategic Growth Plan and the forthcoming City Deal Fund projects. Members ratified the application for the designation, and you're aware that this is obviously a political and values driven initiative and seeks support across the full range of statutory, community and private sector and academia sectors. So members, just in terms of moving, I've outlined the joint funding arrangement with the Public Health Agency, which is to be welcomed. And to seek your approval in taking forward this over the designated period to be reviewed on an annual basis of the 4-year term of WHO. Thank you.
Thank you, Karen. So, sorry, Mr. Farrell, Rory.
Thank you, Chair, and thanks, Karen, for the report. As you say, we discussed this at length 2 months ago. So I'm happy to propose the item. I think the Healthy City designation is something we should be fighting for, and the 3 key aspects of our plan or programme around promoting green spaces and blue spaces to enhance physical and mental health. Our investment in medical education through the medical school and City Deal innovation projects, and the use of greenways and the regeneration projects along the riverfront associated with the City Deal. They're going to make a massive, massive difference to the city, and they're going to make a massive difference to the health of people right across this city and district. So happy to propose on behalf of the SDLP. Thank you.
Councillor Boyle McKeel. Who's in second, the members? People. Thank you. Item 14, again, ask Karen, please.
Chair and members, this is to advise you of the APSI Northern Ireland Social Value Forum, which takes place in November. The itinerary for the event has been included for your information, so I think the report is self-explanatory. There is an associated cost which will be covered from within your elected member training budget. So seeking your endorsement of the recommendation that should interested members wish to attend, that would be the case. Thank you.
Okay, members, people have enough. Okay, item 15, Barry, please.
Thanks, Chair. Members, the purpose of this report is to inform you of the recommendations of the COVID Sports Recovery Grant Aid Assessment Panel and to seek approval of the same. Members, you'll be aware of the additional funds of £424,503 and an allocation of £80,000. A new round of grant aid for Sports Club COVID Recovery Fund was approved. from the above budget. The clubs were eligible to apply for up to a maximum of £4,000. We received 44 applications, having scored above the threshold of 60%, and you'll see in Appendix 1 the assessment panel's recommendations, and these were also presented to our sports committee. The total budget members were proposing a further 18,124 is allocated from underspends from the community grant aid, and that would ensure that we could fund all of the sports clubs that applied and achieved over the 60% threshold. So members, it's recommended that you endorse the decisions of the assessment team and the sports committee to award a sports recovery grant to those applicants who scored 60% or above, and to agree to the movement of the 18,124 from the underspend within community sport to fund all of the groups. Thanks, Chair.
Again, you, Barry. Councillor Boyle, Michaela.
Chair, just delighted for all the successful applicants who scored over the threshold. Very welcome funding for much needed funds for COVID recovery in terms of sports. But I also want to declare an interest as a member of Strabane Sigerson's GA Club, which is one of the successful applicants. And happy to propose the report and the recommendations.
Thanking you, Michaela. Councillor Tierney, Brian.
Chair, thank you. And like Councillor Boyle, I'm delighted to see that we're getting this money out to clubs, and I'm happy to second it. I'm slightly disappointed that a particular football club, who I would do a bit of work with, hasn't received any funding. But I suppose that just shows that we have to do an extra wee bit of work around that. But happy to see the money going out and making sure that it's been put to good use. Also content with the recommendation of the money, the 18 grand I think it was it, from the other fund to be allocated to ensure that we can stretch this as wide as we can. So thanks to Barry for the report as well.
Thank you, Brian. And I just see in the chat box that Councillor Stephen Edwards has declared an interest as a member of our GAA. Folks, the item has been proposed and seconded, and unless anybody has anything further, take it as accepted. Thank you. Item 16 again, Barry, please.
Members, the purpose of this report is to inform you of the decisions of the Sports Committee Club Maintenance Programme Selection Panel. Members, you'll be aware of the need to establish and deliver a club maintenance programme was one of the recommendations of our recent playing pitch strategy, and it was agreed by members in July 2021. Clubs can apply up to £2,000 to assist with maintenance of their playing fields. The total amount to be allocated through the club maintenance grant aid programme is, and members, is an error in section 4.2. It's actually £55,775.20. So in terms of the recommendation, that members endorse the decisions of the assessment team and the sports committee, and you'll see within your appendix 1 all of the groups that would receive the funding. Members, thank you, Chair.
Thank you, Barry. Councillor Duffy.
Yeah, Chair, just happy to propose this.
Seconded, Councillor Tierney. Brian, thank you. Once again, folks, if everybody's content, they move on, and thanks to Barry for the report and the work. Once again, Barry, moving on to item 17, please.
Thanks, Chair. Members, the purpose of this report is to seek your approval for the recommendations of the COVID Community Support Grant Aid Assessment Panels, to seek your approval to transfer the 18,124 from the report we discussed around sports 2 items ago, to seek members' representation onto a working group to review current community support, community venue, good relations grant aid programs, and that came out of an action members from one of our previous committees. So members, you would be aware at September Health and Committee, Health and Community Committee, we agreed that applications that scored above 60,000 within the community venues and community support programs, which were currently on reserve list, would receive funding. And it was further agreed that we would deliver a new round of grant aid, seeking applications under the Community Support Fund to specifically support local grassroots community organisations across the council area in the delivery of community development, COVID recovery interventions and programmes. and an allocation to a new round of grant aid to Sports Club Recovery was also approved. At the July Health and Community Committee meeting, it was agreed that officers investigate the potential that future funding allocations will reflect project scoring in the event of 100% funding not being available to all projects and have achieved the threshold score, and bring a paper of options on how council grant aid is allocated. So members, with regards to the open call, you'll see that only 7 applications under the community support programme were received by the deadline. Therefore, we agreed at a management level to extend the deadline by an additional week, and that officers would proactively promote the programme. As a result, an additional 32 applications were received, bringing the total number of applications received to 49, requesting funding totaling £93,536. Total of these, out of these applications, 40 were deemed successful, having scored above the threshold. The budget for the programme was £136,619, and it leaves a balance of £45,083. One application was deemed ineligible. We've also touched members on the Sports Club COVID Recovery Programme and the moving of the £18,000. Officers are currently consulting with the local growth partnerships and advice agencies regarding the additional funding for food and essential items and financial inclusion, and will consider delivery of the balance of 26,000 as part of this consultation and through a further report to committee in December. And in response to the request to look at options on how council grant aid is allocated, it is proposed that a working group incorporating members and officers is established to consider options. In line with the agreed composition of working groups, 1 nomination is requested from each of the political parties and 1 nomination from the independent members in council. So members, from a finance point of view, the letter variation has been received from DFC. So in terms of recommendations, members approve the recommendations of the assessment panels in respect of community support COVID funding, that members approve the transfer of the £18,124, and that members agree nominations onto a working group to review how council grant aid is allocated and consider options. Thanks, Chair.
Thank you, Barry, for that report. Councillor Tierney, Brian.
Chair, thank you, and thanks to Barry and his team for not only the report but the work that went on it to get the report here. And I think it's great to see this amount of money that is going out to community groups right across this council area, who are providing vital services and facilities to ensure that our residents are keeping active and entertained. In terms of 5.3 of the recommendation, I will be the nominee for the SDLP. Before I go any further, and I'm happy to propose it, but I would just like to point out that in the Ballyarnett figure, first of all, I would like to declare an interest in the Greater Chantal Ware Partnership, Northside 50 plus. Not that I'm 50 plus, but it's run by the Greater Chantal Ware Partnership, On Street Community Youth, Galia Residence Group, and I think that's it. Now, in the Ballyarnett allocation, 1 group across this council area was deemed ineligible. And you can see from the score that the Chantal Youth Intervention Group received. Well, they didn't receive any score. There was a clerical error, Chair, in the application actually getting to council, and what happened was they had sent an old application by mistake, and it was their mistake. I appreciate that, but it was a genuine mistake. Now they've asked for £2,000. There's 1,800, I understand, left in the Ballyarnett pot, and I'm wondering, can officers, and I have seen the original application, which I'm happy to forward to officers right now, but can we go back and speak to them and see if there's any way around this, because it was a genuine mistake, and I think, you know, there's money there within the Ballyarnett pot that could, obviously won't cover all of what they've asked for, but would cover a large percentage of it. So can we find out if that would be a possibility, because the application that was to come in is based around a Christmas type extravaganza event within the local area, and I think would have benefit within the local area. And as I say, it was a genuine clerical error. and I know that the people and the young people involved with this group will benefit from this program. So can we maybe look at that and see? Thank you, Chair.
I thought you were going to say we'd already spent the 18,000 two minutes ago, but anyway. Councillor.
Yeah, thank you, Chair, and thank you, Barry and the team, for comprehensive reporting. Obviously, a lot of work that has gone on behind it. I think it is really important that we continue to work through our local growth partnerships for a lot of this stuff. And I have always had the view that the grant aid process has been as fair as possible in terms of coming to decisions around funding of groups. I would agree with Councillor Tierney, and if that could be looked at, I would be supportive of that suggestion. Just in terms of the nomination from our party, Chair, I'd like to nominate yourself, Paul Fleming.
From stupid jokes. Okay, folks, reports proposed and seconded, and obviously with officers seeking to take a look at the situation with regards to the club.
Do you want me to come in just on that briefly? Sorry. In terms of that particular group, Councillor Tierney was deemed ineligible, and by accepting that application, we'd essentially be opening up the application process again, which would it's not within our guidelines, and there would be audit consequences. But in terms of trying to assist in the best way we can, outside of that process, you'll see that there's a balance of 26,959. That's split across the DEAs. We were going to bring a report back for information, really, to members where that's going. So if members are content, we can work with the growth partnerships now. It will be a small allocation to each of the growth partnerships, and then the back of that particular project, if the growth partnership are minded to fund it with that allocation, then that'll be up to them. Because if we bring a report back in December, we'll have missed by the time we get approval. We'll have missed that Christmas deadline. So if members are minded, we can allocate that money now to the growth partnerships. We will bring an information report in on what they've proposed to spend on it, but not for approval, really, if members are minded around that.
We appreciate that, Barry. Go on, Brian.
Thank you, Barry. When you started there, I thought you were going to say you were going to give them the entire 26,000, which I'm sure they would greatly appreciate. But no, look, if it's going to bring in audit concerns and stuff like that, obviously, we have to make sure that we have our own checks and balances in place, and wouldn't ask that we go outside those guidelines. So I appreciate the alternative, and would, if you need a proposal that we do allocate the money now to the growth partnerships, I'm happy to propose. I think there was 3 recommendations within the report, plus the added one, that we go to the growth partnerships now and see if we can get this money spent. Thank you, Barry. Thank you, Chair.
Okay, folks, and just to say, coming through and the wires is that on behalf of the DUP, Alderman Devaney has proposed. On behalf of the UUP, Alderman Derek Hussey has proposed, and on behalf of Alliance, Rachel Ferguson has proposed to the working group.
On behalf of People Before Profit, Maeve O'Neill.
Thanking you, Sean, Councillor Maeve O'Neill, onto the working group as well. Okay, members, people, happy enough. Thank you. Items 18 to 25 are for information, but as always, if there's anybody who wishes to address any of the items, you let me know now. Alderman McClintock, Hulry.
Thanks, Chair, for letting me in. Can I briefly just mention item 22, please? The commissioned reports, and I think we've waited for these a long time, and I think that the report coming on the Ubuntu Festival is certainly very welcome, and the fact that it gives some very clear recommendations as to the way forward, and the council will play a leading part in these. But I'm a wee bit concerned about the report on Tully Alley, Currynearn, which is one of our most deprived areas, and it has a serious lack of community infrastructure in the area. The report is what it is, but it seems to put the onus, all the recommendations really are about they can look to certain funders to progress things themselves. I'm just wondering, just in terms of council input, I know it was a commissioned report under the Good Relations team, but I'm just wondering, is that it now? We have commissioned the report, and are they on their own again, or do we have any role? Because the Ubuntu report is so, council is going to be very much involved in that. But where do we sit, just for clarity, with the Tully Alley and Currynearn? Because Currynearn, without workers, and Tully Alley, that is seriously funded. And I know that they've been doing some work in Tully Alley recently, gathering views of local people, but they actually don't have the workforce to put in all these funding applications or whatever. So just if I get a wee bit of clarity, is it just a case that we commissioned a report, full stop, hand it back to them, and that's that? Or whether we're taking any actions through Good Relations or through any other, through community development, just to give them any assistance? Thank you, Chair.
Thank you, Hilary. Councillor Sean Mooney on the same issue. Sean.
Thank you, Chair. I'm not a member of the committee here, but I've just heard Alderman McClintock's comments, and I would like to endorse those in relation to Currynearn and Tully Alley. I've been engaging with Currynearn lately as well, and obviously echo the same comments as Alderman McClintock. You know, the community association is getting on their feet again down there, so any assistance that council could provide, as well as Tully Alley, would be very grateful down there. And I just like to sort of echo what Alderman McClintock has said and endorse her comments in relation to those as well. Thank you, Chair.
Thank you, Sean. Folks, on item 21, I have two indicated speakers. Councillor Tierney, Brian.
Chair, thank you. And really just to welcome the report and obviously the funding, which will allow the Community Crisis Intervention Service a further 3 years funding. People will know that this service is totally and unfortunately totally and absolutely needed within this council area. And I see from the report to date, as of the 1st of October, 918 interventions made of people who were suffering from low mental health. That's a shocking figure, and imagine what might have happened if this service wasn't in place and those people weren't doing the fantastic work that they've been involved in. So they welcome the funding for a further 3 years. The Community Crisis Intervention Service, as people will know, previously was going on a shoestring budget from 3 months to 6 months to 3 months, and there was never no security for the staff. There was never no security in terms of a step down process for the service users. So I think it's great to see that the Minister for Health has allocated this funding and will allow this extern to carry on this role, supporting the most vulnerable people throughout the city and district. And we can see from the figures that this work is badly needed. So it should be welcomed, I think, by everybody. Thank you.
Thank you, Brian. Councillor McGinley, Emma.
Good Chair, just on the same issue, and I completely concur with Councillor Tierney and on behalf of Sinn Féin and welcoming the report for the funding for the Community Crisis Intervention Service. As Brian had touched on there, you know, it is no secret that we're in the grips of a mental health crisis across the city district and even wider than that again. And the work of the services such as the Community Crisis Intervention Service that they're doing is vital in supporting the most vulnerable in our society that find themselves in crisis. As Brian had also touched on there, you know, the fact that they've delivered 918 time critical and immediate interventions to people in crisis who are at risk of suicide or self-harm, you know, that figure in itself is a testament to the absolute need for the continuation for the funding of this project. And the 3 years allows staff now to focus on the delivery of service as opposed to firefighting for funding, to allow the services to continue for at least that 3 years. So I think it's important that we as a council and a committee recognise and acknowledge the support for mental health services, but we don't lose sight of the scale of the crisis of mental health. and that we're committed to doing all we can to promote positive mental well-being and supporting people who are facing mental ill health going forward. For my good.
Thanking you, Emma. Folks, I don't have any other indicated speakers in terms of matters of information, so I'm going to ask for a proposal again, the confidential. Councillor Tierney proposed, Councillor Farrell seconded. Give us a couple of minutes or a minute or two till we get in the confidential.